بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله صلى الله عليه وسلم. Welcome to all participants in this course, which organized by King Saud bin Abdulaziz University for Health Science and the Ministry of National Guard. And it is updated version 2020 under name Baby Friendly Hospital Initiative, which was previously named 20-hour course for healthcare workers. This course to complete the requirements of Step 2 in Baby Friendly Hospital Initiative standard. Sorry for the late starting, but because of the something issue in the network. The course is accredited with a 20-hour educational hours by Saudi Council for Health Specialties and will proceed over 3 days from today to Thursday at a rate of 7 hours per day, includes 1 hour break from 8 in the morning to 3 in the afternoon. The course elements will be scientific lectures and exercises. For practical training, the practice format will be explained and discussed by the trainers. Practical application will be provided in a separate course after disappearance of COVID-19 epidemic. It's supposed there will be clinical practice, but it is postponed because of COVID-19. After completing this course, participants will have the knowledge, skills, and competence to protect, promote, and support breastfeeding in the facilities where they work, as well as understand the importance of the 10 steps to successful breastfeeding and translate them into practice. You will get the benefits, and this is the main expectation from this course. The scientific reference book is the participant manual. I think that's all participants now. They get copy from this by email. This participant's manual contains copies of the key slides that you may want to memorize, forms, lists, and checklists of exercise, and practical and clinical practice sessions. This will be used later. Written exercises that you will be asked to do individually. There is interactive sessions later on, maybe today afternoon and tomorrow and the last day also. In order to get benefits from this course, we wish all participants sign in on time, switch off your mobile or keep it silent, and keep timetable and participant manual if you have a copy nearby. Submit the evaluation at the end. Write the questions in the chat and any inquiries, as well as participate in the exercise and interactive sessions. You can write your questions in Arabic language or English language, whatever, we will answer. The response to all questions will be at the end of the day, around 2:30, and end by 3:30 p.m. daily. Any questions? If you have any questions before we move to the first sessions, please write it in the chat and we will respond to it. Bismillah ar-Rahman ar-Rahim. Now we will start our first sessions under the name Baby Friendly Hospital Initiative, a key component of quality maternal and newborn care. After completing this session, participants will be able to describe the importance of exclusive and continued breastfeeding, discuss the WHO and UNICEF global strategy for infant and young child feeding, outline the baby-friendly hospital initiative, list the 10 steps to successful breastfeeding, inshallah. The first few hours of a newborn babies are a critical window for establishing breastfeeding. The WHO and UNICEF recommend infants should be exclusively breastfed for first 6 months of life, and breastfeeding should be continued for up to 2 years of age or beyond. This is part of optimal breastfeeding practices. But many mothers have difficulty breastfeeding from the beginning. So all healthcare who's taking care of women and children play a role in establishing and sustaining breastfeeding if he will train. So this course, the maternity course or 20-hour course or baby-friendly course, a first gate for training and qualification in lactation medicine and breastfeeding management. To enable mothers, parents, caregivers to establish and sustain exclusive breastfeeding for 6 months. The exclusive breastfeeding means only breast milk, no other fluids or food given before 6 months of age. So WHO and UNICEF recommend immediate and uninterrupted skin-to-skin contact from birth and initiation of a breastfeeding within the first hour of life. Breastfeeding responsibly as long as the baby wants, day and night. Counseling mothers on the risks and use of feeding bottles, teats, or pacifiers. Here, counseling, and will not say no, but I will counsel the mother about use of this. To achieve the succeed in this and reach the sustained exclusive breastfeeding, we need a guidance or policy or a program to achieve the succeed. WHO and UNICEF endorsed the global strategy for infant and young child feeding in 2002. The main goal of this strategy to improve the nutritional status, growth, and development of infants and young children through optimal feeding practices. Also, there is another goal for the strategy to support exclusive breastfeeding for 6 months, followed by timely mean at 6 months, adequate and safe and appropriate complementary feeding, and there will be a separate session for this, and in the session you will understand what's mean each term, the meaning of each term. So timely, adequate, safe and appropriate complementary feeding and continue breastfeeding for up to 2 years and beyond. To support also another goal, to support maternal nutrition through social and community support. What does baby-friendly hospital initiative means? You can write your answer in chat and I will pick up 3 answers. Okay, we'll continue. Thanks for all sharing. Baby-friendly hospital initiative started as WHO and UNICEF initiative in 1991 with main aims to provide healthcare environments that helps mothers acquire necessary skills to exclusively breastfeed for 6 months and continue breastfeeding up to 2 years or beyond. Another aim to promote implementation of all the 10 steps to successful breastfeeding. Now you can see the infographic pictures for 10 steps to successful breastfeeding. This is the modified version and this revised 2018 10 steps. Question: which launched first, the 10 steps or baby-friendly hospital initiative by WHO and UNICEF? Also, you can write your answer in chat and I will pick up the first 3 answers. Okay, so thanks for your answer. The 10 steps original version first before the baby-friendly hospital initiative launched. 2 years lap between them. The original version of 10 steps was 1989 and the baby-friendly hospital initiative launched 1991. The revised 10 steps in 2018 and updated guidance of baby-friendly hospital initiative in 2017 and the guidance book published in 2018. Here, this is the 10 steps to successful breastfeeding revised 2018. It divided in 2 parts. Part 1 related to the decision makers or the higher authorities. We need approval from the decision maker before take this action. The second part started from step 3 up to step 10. This done or handled by healthcare workers. It's not need necessarily action by the higher authority. Healthcare worker can deal and play a big role and implement these steps. Step 1 subdivided to A, B, C, and the code added and on the top of the 10 steps. Written policy, ongoing monitoring. The ongoing monitoring added in the new versions. And the next slide will show the difference between the original 10 steps and the revised 2018. About the explanation of the 10 steps and how to implement, there will be a specific sessions for each step. So the course structure explain the implementation of each step. We'll start with step 1. Step 1 in the old 10 steps or the original 10 steps, only one title have a written breastfeeding policy that is routinely communicated to all healthcare staff. In the revised version, they divide this step 1 to 3 parts, and the policy, infant feeding policy, the breastfeeding policy here modified to infant feeding policy. So instead of saying breastfeeding policy, we will say nowadays infant feeding policy. This includes infant feeding policy include breastfeeding, lactation, infant feeding, feeding formula, complementary feeding. So all this under the infant feeding. Also, they add this policy to be communicated to staff and parents, while in the original sessions distributed to staff only. Now this policy in the middle of this subdivision, in the top the code, and in the bottom monitoring and data management. The monitoring new, they added in the new version, but in the original 10 steps wasn't applicable that time. This is about the step 1. So we need to restrict to the code. We need to implement policy for each institute, and the important monitoring and data management, statistic, and annual report or biannual report. It is necessary. Step 2, in the original, here in the right side, the original 10 steps that published or released 1989, and the left side, the revised 2018, the updated 10 steps. Step 2 in the original version, train all healthcare staff in the skills necessarily to implement this policy. This modified the training staff, replaced by staff competency, and that involve and include all the knowledge, all skills that needs to support breastfeeding mothers. Step 3 in the original 10 steps, inform all pregnant women about the benefits and management of breastfeeding. The word inform modified and changed to discuss the importance and management of breastfeeding with the pregnant women and their families. Also, this added in the new version, discuss with the families. In the original one, the families wasn't included at that time. So the difference between inform and discuss, inform we can distribute pamphlets, educational materials without sitting with mother face to face. But here in the new version, we discuss, this means face to face, sitting with pregnant mothers, sitting with the families, taking care of this newborn, and discuss all the importance and management of breastfeeding. Step 9, in the original 10 steps, saying give no artificial teats or pacifiers, also called dummies or soothers, to breastfeeding infants. Word no modified or changed to counsel. Instead of saying no, nowadays we will say counsel mothers on the use and risks of feeding bottles, teats, and pacifiers. So we need to sit with the mothers in the counseling sitting with the counselor or educators, lactation educators or lactation consultant. So need to sit with the mother and counsel about all the risks. This is in the new version. Step 10, in the original version, step 10, foster the establishment of a breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. This modified to care at discharge, and this concentrate on coordinate discharge. So we need to make a link between the hospital and the primary health care centers, or between the hospital and the ongoing support or support groups in the country, or that link with the institute. Now we will move to local situation of the baby friendly hospital initiative. In order to know each country about the local situation, it is possible to view a recent study issued by Mother and Child Friendly Care Association, and this published in Egyptian Journal for Breastfeeding in May 2019. And we can browse together this later on. Sharjah is a baby-friendly city that gives the Eastern Mediterranean region's leadership in the baby-friendly initiative and makes it a model for the regions in the world. So this includes in that recent study. If you will visit or browse the site, you will see this nice success story about Sharjah and one of the Arab countries. We'll take one example from that study. We'll take Saudi Arabia, number 5 from, and all Arab countries seen the update in Baby Friendly Hospital Initiative. It's published in that recent study. About Saudi Arabia, there is start with country profile, then they mention nutritional status of children and more information. Anyone can visit this site and read about each country. Now we will talk a little bit about the trend of breastfeeding in Saudi Arabia. In Saudi Arabia, the initiation rate high, and this drops with age until the continuation rate is down. So the trend is high initiation rate and low continuation rate starting at 1 year. And the most drop at 2 months of age is mostly at mother's return to her work. If you want to know more about your country, you can visit either the published article and you will read about all Arabic country. If you want more to know about breastfeeding statistic, breastfeeding rate, initiation rate, continuation rate, and other statistics, you can visit WHO. We can browse it all together now, And we'll take example. I hope it will be clear for all of you. So anyone can open this link here, country profile. Now you can open country profile, click on country profile, and then you can choose your country here. It's not shown here, but there will be you can choose your country. Then after that, click, you will see all the information about your country. Either if you write anyone from Gulf regions, from Arab countries, from Saudi Arabia, can write the name of the country, and then you will see the nice information about the country profiles, all the statistics, and breastfeeding rates. Also, there is another scorecard named World Breastfeeding Trend Initiative. Also, we can browse it now together and see the statistics and country profile about the breastfeeding trends in this website. I hope all this clear to the participants and can view it. From all these three websites, we can visit the national or local breastfeeding situation. Here, this is the World Breastfeeding Trend Initiative. Total number of countries reported 98. Only what you need to write your country, and you will see the nice profile about all Arab world countries and Gulf regions and Arab world countries. This is very interesting site, and a lot of information can we pick up from World Breastfeeding Trend Initiative. This slide shows the percentage of births in baby-friendly designated facilities. This published 2017. I didn't find the update one. This is the last one I get. The dark blue represent the higher percentage. This means the high numbers of baby-friendly hospital initiative in the dark blue, sorry, and the light blue color, the percentage in the middle between 20 and 50%, and the light blue less than 20%. For example, our country here, Saudi Arabia, represent a light blue or gray color. This gray color represent less than 20% of birth in baby-friendly designated facilities. The brown color, this unknown, it's no information, it's information not submitted maybe. The very light blue, this means none of them, no baby-friendly hospital initiative. Here, this table shows this is the form or one format of the country score card. This is one of the homework Each participant need to fill the information on the left side, the questions, and in the right side, we need your answer, either about your country, data about your country, or data about your institutes, either hospitals or primary health cares or university or community setting, whatever that your work. We need this, the deadline, or we need to collect it in the practical course, inshallah, after disappearance of COVID-19. Thanks so much for your listening, and I hope we covered the baby-friendly hospital initiative, and you will enjoy, inshallah, the course with the next speaker. Thank you.
Assalamu alaikum. Good morning, everybody. This is Dr. Amar Rusayes, consultant family medicine and lactating consultant. Okay, we will discuss together now session 2, the benefit of breastfeeding. As you know, the WHO and UNICEF recommend exclusive breastfeeding for the first 6 months. And this recommendation came based on the benefit of the breastfeeding for both mother and infant. So in this session, we will state the advantage of optimal infant feeding and the special property of colostrum and why it's important also, and describe the main difference between breast milk and artificial milk. And we will see together the risk of artificial feeding if not breastfeed. And we will see regarding the advantage of breastfeeding, important of, as we mentioned it before, both infant and mother, and risk if not breastfeed. This slide shows the benefit of breastfeeding in general. We will see the benefit of the breast milk. The breast milk contains the complete nutrient what the baby needs, and it easily digested and efficiently used by the baby body. It's protect against infection, and also it provide long-term protection against chronic non-communicable disease such as obesity, even in the adulthood, hypertension and diabetes, with also bronchial asthma. The breastfeeding also help mothers and baby to be bound together, so making a close, loving relationship, which is not be with the artificial feed. It help also baby development, protect the mother health. How? It's protect the mother health by help the uterus to return to previous size before pregnancy, and this is will reduce the bleeding and therefore prevent the anemia. And there is evidence that breastfeeding decreases the risk of ovarian cancer, breast cancer in the mother, and can help to delay new pregnancy. Also, from the benefit of the breastfeeding, the cost is less than artificial feeding. And this is point may be more important to the father. That's why we need also to counsel the father regarding breastfeeding, the important, and we stress on this point maybe to support the mother for breastfeeding. Okay. This slide shows the nutrient component of the milk and the breast milk and formula. As you see here, the tall part show the nutrient component in the breast milk, which is complete. But the formula, the short part, show the component of the formula milk and can be adjusted, but still lack the other component which shown in the tall part, tall chart. And so from this slide, you can see there is a different in component, which is the tall chart show the important and complete component with antibody and substance that protect baby from the illness, which is present in the human milk but lack in the formula. Also here, the nutrient component, that three important components in the human milk and animal milk. Why should we know the difference between animals and human milk? In order to understand the composition of the artificial milk and human milk, we need to know the difference between both, to know the difference in the composition and later on the advantage. The three component, which is the fat, as you see here, the fat provide important for energy, protein also important for growth, lactose, which is sugar, and also provide energy. Okay, what is the difference between the amount of the protein? If you concentrated on the middle part of each milk in this slide, which is the protein, there is a difference in the amount. Actually, in the human milk and the animal's milk is more. As you see, the animal's milk is more in the protein than the human milk. But actually, this amount is not needed by the infant. Why? Because the baby still having immature kidney, which is unable to excrete the extra amount of the protein in the animal milk. Instead, the human milk contains the essential fatty acid needed for the baby growing brain, eyes, and also blood vessels. Also, the protein is not different only in the quantity as it's shown in the previous slide, but also in the quality. The quality of the protein is different between human milk and cow milk. So when the quantity of the protein in the cow milk can be modified in the formula, but the quality cannot be changed. That's why when the milk substitute company, when they came to you, tried to convince you that the formula can be adjusted to be similar or near to the human milk, actually this is not true. Why? Because the quality of the protein cannot be changed at all, not as the quantity. In this chart, you can see the casein type of the protein in the cow milk is more, which consists about 80% of the total protein. But in the human milk, not greater than 40% of the total protein. And also the type of casein protein in the cow milk is thick and indigested, which is become thick on the baby's stomach. That's why maybe the mother of the baby on formula came complaining of that baby is not comfortable to this milk and trying to change the type of formula into other type, and it's be the same, because causing intolerance to him, causing diarrhea. But this is cannot be with breast milk. While the whey protein, which is more in the human milk, this is what actually baby need more, because it contains anti-infective protein and help to protect baby against infection. And this is what the baby need, especially in the early life. So this slide shows the summary of difference between between different kind of the milk, human and animal's milk. As we mentioned, the protein in the human milk contain the correct amount of what baby need, but in the animal's milk is more, and it is difficult to be digested. The fat in the human milk contain enough essential fatty acid and contain lipase, which is important for digestion, but it is not found in the animal milk. Also, the water in the human milk is enough, but maybe with the animal's milk extra needed. And in the human milk, there is anti-infective properties, which is absent in the animal milk. And also the breast milk, the composition of the breast milk is different according to the gestational age, if baby preterm or full term, stage of lactation. So the composition of the mature milk is different than the beginning, which is colostrum, and also during the same feed. We will see later the difference between foremilk and hind milk. Here, the difference between each type of a breastfeed, which is first colostrum, and mature milk, which can be divided into foremilk and hind milk. Okay, what is the colostrum? Colostrum is the first breast milk in the woman being to be produced at the end of the pregnancy and in the first few days after delivery. And it is thick, yellowish in color, contain, as seen in this slide, contain high protein than breast milk later on. Regarding mature milk, at the beginning of the feed, it's called foremilk, which is thinner milk and contain greater amount and it's produced in the greater amount of early feed, provide also protein, lactose, and water, and other nutrient need for baby. That's why baby not need to extra water during the first 6 months. Some mother have believes that she need to give her baby a water, which is actually not need. Why? Because it's from the component of the milk and provide the baby the enough amount of the water what he needs. So no need to give a baby in the first 6 months, no need to give him a water. The breast milk is enough. Regarding hind milk, which is the white milk produced later in the feed, contain more fat than foremilk. That's why every time we counsel the mother to give her baby a complete meal, which is foremilk and hind milk. By complete this meal, which is foremilk and hind milk, the baby will get the most component that he needed. Okay. Here the colostrum, the amount of the colostrum in the first few days is very small, around 2 to and not exceed 10 ml. And remember that the baby, this is produced and given immediately after birth. And the baby in the beginning have a small amount, have small capacity of the stomach, and still learning the suckling and swelling. So this small amount is less likely to cause the baby to shock. And the colostrum contain the immune factor and the important factor needed for the baby at early life. Colostrum has laxative effect. What's the importance of this effect? To clear the baby gut meconium, which is the first dark stool, and clear the bilirubin from the gut, so to prevent the jaundice. Colostrum also contain many growth factors needed for baby development of intestine and prevent baby from developing allergy or intolerance to other food in later life. So colostrum is present in the breast before a baby born. So the baby should not be given any drink, any food, any supplement before start breastfeeding. Breast milk, as we see in the previous slide, it contains important component and also contain white blood cell that is protect baby against diarrhea, many infection as ear infection, respiratory illness, and also breast milk contain antibody against infection that the mother had before. So the baby should not be separated from their mother when she had infection. Why? Because her breast milk help to protect baby against the infection. Because the mother have developed antibody which passed through the milk to the baby, so it will protect him. No need to advise mother to stop breastfeeding if she become illness. This slide show the risk of diarrhea according to the feeding method. As you see, with the breast milk, the percentage of baby with the diarrhea is less. So the breastfeeding is decrease the risk of diarrhea compared to other milk. And here also the relationship between feeding type and respiratory illness. The black column, which is baby with breastfeeding, as you see, is less respiratory infection than artificial feeding. Also, the frequency of acute otitis media and also other infection is decreased with breastfeeding compared to the mixed or artificial feeding. In this cohort study, we saw that children with exclusive breastfeeding decrease their risk of asthma and atopic rhinitis, atopic dermatitis, and allergic rhinitis compared to the children who breastfeed, even breastfeed, but for short period. Also, there is psychological benefit of breastfeeding. As we mentioned before, the breastfeeding have important psychological effect and benefit for both mother and baby. This close contact immediately after delivery help the mother and baby to bond together and feel emotionally satisfied. And baby tend to cry less if they breastfeed from their mother. And there is some study suggest that breastfeeding may help a child to develop more intellectually more than baby who's not breastfeed. This slide shows the duration of the breastfeeding associated with higher IQ score in young adult. As the baby breastfeed more, the IQ will be higher than baby who breastfeed in less duration. Okay, what's the benefit of breastfeeding now for the mother? It protects the mother health. As we mentioned before, it helps to reduce the risk of uterine bleeding by helping the uterus to return to previous size before pregnancy, and evidence that breastfeeding reduces the risk of cancer as breast and ovarian cancer. It helps to delay a new pregnancy, and the important also this point most important for the mothers that help to return pre-pregnancy weight, trying to return pre-pregnancy weight than before. The benefit of breastfeeding for the family. So better health, nutrition, and well-being. Economic benefit. The breastfeeding cost is less than artificial feeding. Breastfeeding result in lower medical care costs also. What is the benefit of breastfeeding for the hospital? Warmer emotional environment, no nursery, so there will be more hospital space, fewer neonatal infection, less staff need to be caring for baby if the baby will be with the mother, so no need to nurse or other staff to taking care for the baby. Improve hospital image. As you know, the breastfeeding is the criteria for baby initiative center or hospital, and safer also in the emergency. Okay, if not breastfeed, is there any problem? Yes, there is a risk if baby not breastfeed. Artificial feed baby is more likely to become ill with diarrhea, respiratory infection. Why? Because the artificial feeding lack anti-infective factor. And so artificial feeding may contaminate with harmful bacteria, and also from the preparation of unclear water. And also there is increased risk of allergy, milk intolerance, risk of chronic disease as diabetes, hypertension, obesity, bronchial asthma, lower score in intelligence test compared to baby with breastfeed. Mother may become pregnant sooner and increase risk of mother's anemia and ovarian and breast cancer. This slide summarizes the risk of artificial feeding. Here more with the baby, and this is the risk of the mother down in the down slide. Okay, thank you. And if there is any question, you can comment it and we will answer it later.
بسم الله السلام عليكم ورحمة الله. دكتورة مريم العويرضي معاكم. Our session now it's about counseling skills. What we mean if we said counseling or consultation. Counseling, it is a way to understand how people feel and help them to decide what is best to do in their situation. Why it's important? Because our aim to find a way to help the person in counseling session to understand the situation and decide what is best for her or for him. Here in this course, we are focusing on mother who are feeding their newborn babies. It doesn't mean, and this we refer to the mother because we are concentrating on the mother, but the whole caregiver or the parents, example, a father or a grandmother involved should be involved if it is the consultation or the counseling with them. The counseling useful in breastfeeding, as this course, the whole course about breastfeeding, and it's useful in our life, with a family member at work, and we can practice this skills with your family member or at work to practice the skills and to get familiar with it, and it will be easy in the consultation. this skill will help the mother to easily talk and give you more information, because if you master this skill, you will let her feel you are interested and ready to listen, and encourage her to tell you more. And even if she is turned off by this skill, will help her just to be open. Okay, what is our objective in this session? To learn listening and learning a skill. Give example for each skill, and then demonstration appropriate skill when counseling a new mother or on feeding her baby. We'll start because the communication, we defined the counseling process, what is that? Now with communication, what is the communication? It's a process of information or interchange information and idea and feeling and opinion between a sender and receiver. A sender, it's the health provider. Receiver, the caregiver or the mother. To send this message in the right way, we should have a communication skill. This communication skill is non-verbal and verbal. This is our six key listening and learning skill in this session we will learn together. First one, use helpful non-verbal communication. Ask open question, use response and gesture that show interest, reflect back what the mother, parent, caregiver says, empathize, avoid using judging words. We'll explain each single with the example. We'll start with non-verbal communication. Our body language speak either our eye or our body speak. It's not the communication, as we said, is not about word we say, but even how we look. This it's helped to mother to understand or to communicate with us, and also it's important to observe the mother during the counseling, how it's her body language, because it will tell about her situation. Maybe she's not comfortable at that position. You can help, and you will gain more from this consultation. If you find the mother is not comfortable, and help her to be in a comfortable position, she will feel safe and talk more. Here in non-verbal communication, we should be aware about our posture. We should sit at the same level and close in acceptable distance to the mother. Why we should have this posture, or should be in the same level? Because different level, it feels not that the other person is not comfortable. I mean, the mother or the counselor, it should be in the same level. If she is sitting, you should sit. If she's on bed, try your best to bring a chair and sit near to her and at the same level. The other one is eye contact. Eye contact would mean look at her or at him to show you are interest and you are listening. The eye contact, it should be in a smooth way. Try your best and know you're looking. It's in a nice way, in a kind way. This will avoid try this eye contact with the patient. Give a message you are listening and you are interested what she said. Barrier, if we try to remove any physical barrier between you and the caregiver, either desk or even if you carry a paper or bag, or try to keep your hands open without anything and there is no any barrier. Take time without hurrying or looking at your watch or mobile. You should show her you have a time. Let her to talk. Here touching, it's touching her in appropriate way by touching arm or a hand. Never touch her breast or her baby unless you have a permission and there is a reason for that. I will give you example for this and we'll give you time after each one just to decide what is the best scenario, 1 or 2. Just to for you to remember this. And for example, if here I have 2 scenario, 1 and 2. 1, if you sit in the same level with the caregiver, the scenario 1. The other scenario 2, stand with your head higher than the mother. What you think it's the best situation to let the mom or the caregiver talk more? Scenario 1 or 2? Scenario 1, because it is the same level. Just to try this with any member. I mean, it's if you have it at home or at work, you will figure what's the difference. And ask the other person. You just play this through the role play with them. What she or he feel about this position, or so we will find sit on that head in the same level. It will be better and comfortable more. Regarding the eye contact, if scenario 1, I'm looking at her and pay attention as she speaks. Scenario 2, I'm looking away at something else, or I'm writing my note, watching my mobile, or watching my watch. Which scenario will be more comfortable and encourage the mother to talk more or to continue this counseling session? Of course, it is scenario 1. It is look at her and pay attention. Here, just I want to mention if someone said, no, I'm looking at her. If it is there is a different gender is not comfortable. Okay, we can just gently away our eye from her, but you should just show her you are listening and you're still with her. Don't distracted by any other thing. It's okay to adapt different situation, but with try to be a minimum according to the culture. Here for barrier, if they have scenario 1 and scenario 2. Scenario 1, remove the table and all the notes, you have it in your hand. Scenario 2, sit behind the table, write a note while she's talk. Look at your mobile and your mobile phone and look at what you think the best or the comfortable counseling session. It's 1 or 2. Of course, it's scenario 1, remove the table and there is no any barrier. Taking time, it's very important, I mean, to show the mother and you are not in hurry. In scenario 1, will sit down and degrade the mother without hurrying. We stay quietly smiling at her, watching her breastfeed and waiting her to answer. Scenario 2, we are in hurry, greet quickly, show sign of impatient, look at your watch and mobile several times. What scenario is best for continue this counseling sessions? Of course, the first one. Touching, as we said, it's if you touch her hand, if there is any reason for that, or her arm, it will be better than just ignore her if she is crying or but again, touching her breast or baby, it should be after permission if needed. The other here, we finish non-verbal communication. Now we will start with verbal communication, but we have to remember the tone of the voice is very important during verbal communication. Always the sound should be gentle and kind when we're talking to the mother, parents, or caregiver, because it's the tone high, the message to the receiver, you are shouting. Ask open question here. We have different two type of question. It's open question, closed question. We preferred open question and we recommend open question. It's why? Because open question let the mom to talk more, to give. It's not like you close the question, the answer yes or no. You will not gain any, or it's not, there is no more information. Open a question like how, what, or started with how, what, when, where, who. A closed question usually is like, are you, did you, has the baby? The answer yes or no, and then the mother will stop. Why this is important? Why it's the open question is important in a counseling session? Because you want to encourage the mother to share information, and this allow her to use time to talk and to talk more. It's not if you think the mother unwilling to talk to you, maybe the mother may feel frightened that she will give you wrong answer if you ask her question yes or no. But it's easy to give you the answer what you want. But giving open a question, let her, I mean, give her a way to explain what she think or what she feel. Here we have two scenario, scenario 1 and scenario 2. It's we just pretend I'm talking to someone. I'm Dr. Maryam. I have my client or my caregiver. Her name is Wafa. Good morning, Wafa. I'm Dr. Maryam. Are you and your baby well today? Wafa, yes, we are well. Are you breastfeeding him? Yes. Are you having any difficulty? No. Is he breastfeeding very often? Yes. Here, it's closed question. The answer, yes or no. There is no more information. You don't have any feeling, you don't have any information to discuss with her. While in the other scenario, good morning, Wafa, I'm Dr. Maryam. How is your baby? She's well and she's very hungry. Oh, tell me about how you are feeding her. She is breastfeeding. I'm thinking of giving her a bottle of formula in the evening. What made you think of doing that? She want to feed too much at that time, so I thought that my milk is not enough. Here, with the open question, the the doctor or the health worker ask open question, the mother could not answer with yes or no because um, there is no way to say yes or no. Our question is open, so we need her to talk. So she gave more information at the counselor, learn more. Here, to show it's very important during the counselor session. It's one of the skills to show interest. How we show the mom or the caregiver our interest by smiling, by nodding, or simply look at her with a gentle eye contact. Plus some simple response like oh, it help the mom to talk more. Why this is very important to help the mother to continue talking, and you show her you are listening and interest. This is very important. Okay. Usually we ask a question to start a conversation by, as we said, open a question is the best to start with. By this way, either using our response, it's help the mother to talk more or to encourage her to talk about her issue more. The fourth one, reflect back what the mother or the caregiver say. Why we need to reflect back? Why? To show her interest, to show that you are, as a counselor, you are listening. Also, to encourage the mother to continue talking. How? By rephrase it. Rephrase the word she said. Don't say it at the same because we don't want it to be like you are copying her and it will be a kind of the mother or the caregiver will not like it. We can use a mixed reflecting back with other response like if I said oh, and reflect plus the open question would help to encourage the mother to talk more. I will give you an example for reflecting as a scenario. Good morning, Wafa. How are your baby today? He wants to feed too much. He's taking my breast all the time. Mm. Ah, your baby is feeding very often. Yes, my mother is telling me I should give him some bottle feed as well. Your mother said that he needs something more. Yes. Which infant formula is best? Here, because the doctor used rephrasing the word, he or she gained more information by reflecting back. The mother said, the mother gave more information. Responses like, so you are listening and following what the mother saying. Reflecting back can help clarify the person's statement. What she mean by that? We see here the hungry baby may not be the main problem, but because the mother comment about her mother comment, it's confusing her. So it will be useful in a consultation and a counseling, and convince her later. Here, the skill number 5, empathize. Here, what we mean by empathy, show the other person we understand how they feel by their point of view. It's from their point of view, just to show them we understand what they're feeling. This is what we wanted during the consultation. Okay, for that mean empathy, and we hear what they say, and we are trying to understand how they feel. We are looking at the situation from their point of view. This help empathy. The mother, she understand or happy we are listening to her and we understand her feeling. There is another thing, it's sympathy. Sympathy is not recommended and it's not the what we want. Sympathy are looking at the situation from your point of view. Why we don't encourage a sympathy on this counseling session? Because the consultation will go direct to the health provider or the counselor. For example, I will give you example to explain how is the difference between empathy and sympathy. If the mother said, my baby want to feed often, and that make me feel so tired. If I'm empathized with her, I will say, you feel exhausted because your baby want to feel very often. This is the empathy. I'm just repeating or rephrasing her word and show her understanding her feeling. You feel exhausted because your baby want to feed more often. Okay, that show her I'm hearing her. I understand her feeling from her point of view. This is good for consultation, and this is a good skill. On the other hand, sympathy, in the same example, I will say, oh, I know your feeling because my baby want to feed often too much. I feel exhausted. Here we will bring the attention back to me as a counselor, or that will not help. That feel, the mother, you are just coming the issue back to you as a counselor. This is not recommended because we are focusing on the caregiver or the mother. Okay, avoid using judging words. As you see, the judging word is a lot. If we always we use this, it's need practice to avoid it. For example, if just we ask the mother, are you feeding your child in a proper way? This will confuse her and will let her to judge herself. What is, I'm reaching the standard or not? Maybe this question will let her to hide information, not to feel bad about herself or just to try to hide something. The word proper way, it's different. يعني there is no standard for this word. It's like right or wrong, sufficient, adequate, enough, inadequate, bad. All this word is a judging word. It's not, and it's not advisable to be used. Open a question, it's help without judging a word. For example, how does your baby feed? Instead of a question like the first one, are you feeding your child in a proper way? This is not recommended, but if we just change it to how does your baby feed, she will feel more comfortable to talk about the feeding. If our question close the question again, we will not get more information. Huge يعني here if the mother want to use يعني the judging a word, it says it's okay because she's explain her situation. Sometimes we can use a judging word for just to give to build the confidence or to give positive feedback. Yani it's there is some circumstances we can use judging word, but it's not open. Practicing avoiding judging word as much as possible unless there is a really important reason to use one. We have always to remember judging a question or open closed question, and this use so that we are encouraged to use open a question. Here is again a summary to our skill today. We learned today. Use helpful non-verbal communication. We said it is posture, eye contact, remove any barrier, and other. Second one, ask open a question. Use response and gesture that show interest. Reflect back what the mother and parent and caregiver say. Empathize with your client. Avoid using judging word. This is our talk. We have some example or exercise. It's a kind of interactive session, but we'll try our best to give you time to answer, and then I will give you the answer. Here we have a question. The question, it's a closed or open. Are you breastfeeding your baby? Is this open question or closed question? It is a closed question. It's a closed question. The other question: how are you feeding your baby? It is open question or closed question. Yeah, it's a closed question. Here we have a closed question. I want you to change it to open question. Does your baby feed open? How can change the question from a closed question to open question? Okay. We can use, when does your baby feed? Okay. Uh, are you having any feeding problem? That's a closed question. I want it now to be open question. How is feeding going? This is as an example, but you can يعني put a different question, but the as we said, the open question usually start with when, how, um, who, what. Okay, here the example for reflecting back. There is a statement and there is a three the multiple choices. Just try to choose one and I will give you the answer. If the mother say, I don't have enough milk, I don't have enough milk, what you are reflecting back or rephrasing, it will be, do you think you have enough? Why does she think that? She said you have low milk supply. What is your choice? A, B, C. The mother say, I don't have enough milk. The best reflecting back, she said, you have low milk supply. Okay. It seems there is another question for reflecting back. It seems my baby doesn't want to suckle from me. A, he seemed to be unable to suck. How long has he been unable to suck? Has he had any bottle feed? This is three different uh, rephrasing your what you will choose. He seemed to be unable to suck. This is rephrasing to my baby doesn't want to suckle from me. Okay, I tried feeding him from bottle, but he spit it out. What the rephrasing will be used? I tried feeding him from bottle, but he spit it out. A, why did you try using bottle? Second, he was unable to suck from bottle. He have you tried to use a cup? This is a three rephrasing. Which one you will use? I tried feeding him from a bottle, but he spit it out. For the best rephrasing or reflecting back, he was unable to suck from bottle. Okay. Here example to show understand or how to empathize with the mother. My baby want to feed so often at night that I feel exhausted. Which one it will show you are understand or you're empathized with her? How many times does he feed? Does he walk you every night? Oh, you are really tired with the night feeding. Yes, this is the best answer to show her I feel exhausted, to show you empathize with her. You are really tired with the night feeding. The other example, my breast milk look so thin. I'm afraid it is not good. Uh, to show her you are empathized with her. Which statement is more your choice? That's the for milk. It's always look rather watery. Or you are worried about how your breast milk look. Well, how much does the baby weigh? The second one, you are worried about how your breast milk looks. This is will show you're empathized with her. The other example, I feel there is no milk in my breast and my baby is a day old already. Your response will be you are upset because your breast milk hasn't come in yet, or has she started a suckling yet? It's always take a few days for breast milk to come in. The best answer to this, to show your empathize with her, you are upset because your breast milk has not come in yet. Okay. Okay. Thank you, and see you tomorrow. Thank you, Dr. Mariam, for this very interesting lectures and very important. The communication skills is very important. Now we will utilize the time between the two speakers to answer one of questions written in the chat. One participant mentioned that he has experience giving that he has experience giving breastfeeding, but not enough milk. There is specific sessions. You will get the answer in session 12. Thanks for your interactive, and we receive a lot of answering the questions in the first sessions. Thanks a lot for your interest being with us. Now the time for the next speaker, Dr. Faiza Al-Jafar. She's a lactation consultant. Dr. Faiza, ready?
Slides. We will do this counseling skill and building confidence and giving support. It is 6 skills and it is continuation to the previous lecture. I am Dr. Faiza Al-Jafar. I am a lactation consultant and I am a lactation consultant and I am a registrar, OB/GYN registrar. Yes, now we can, okay. We will talk about counseling skill in building confidence and giving support. After completion of this session, the participant will be able to list 6 skills for building confidence and giving support. And with the previous 6 skills, so it will be 12 skills that support you to counsel a mother. Give an example for each skill. We will practice examples and then we will demonstrate the appropriate use of this skill when counseling a new mother on feeding her baby. The first skill is to accept what the mother and the parent and the caregiver think or feels. Sometimes when you enter to the room to the mother, you will find the mother, her mother is talking. So you cannot stop her. You have to accept what they say, even if it is wrong idea. So in this practice, we will practice if you face a wrong idea, what to do. What you cannot disagree with her from the beginning, because if you disagree, you will criticize the mother and you will reduce her confidence and you can lose the trust. She will not take any information from you later on, or she will not come for you to seek support. So I don't disagree from the beginning. What I do, I accept what the mother say, her idea and her feeling, to build up her confidence. Then when I agree, if the other response is if I agree. If I agree with a wrong idea, incorrect idea, it will be difficult to correct this idea later on. I will be in trouble. So the good response is to accept what the mother say until you can change what's her thinking later on. Okay, how can I accept? How can I practice acceptance of what the mother think and feel? I can use some of the skills that you used previously in listening and learning. We can use reflection. I will use only, I will reflect what she said only, so that I finish my part in talking and she will continue to talk. Or using empathy. Empathy, just I will describe her situation, her feeling, that I understand you are worried or you are wondering. So I just using empathy and reflection will help a lot in accepting a wrong idea that the mother is saying, or accept a wrong feeling. We will have demonstration. You can find it in your manual, page 39. This demonstration, it is a scenario and a responses from health worker, and we will see what is the good response, what is the inappropriate response. So let us start the scenario. The mother: I want to give my baby a bottle of formula because I don't have enough milk for her. Okay, the health worker will have certain responses. One of them accept, one agree, one of them is disagree, and we will sort out which is which. So the health worker say, I am sure your milk is enough. Your baby does not need a bottle of formula. This response is disagreeing. So from beginning, if I disagree with her, she will disagree with me. She will not listen to what I say later on. The second response: yes, a bottle of formula can sometimes settle a baby. Oh, I put myself in trouble because I agree with a wrong idea. So how can I later on advise her against bottle? So what is the correct one? I will say, I see, you are worried about your milk. So now I describe her feeling. She's worried. Okay, this is empathy, using empathy to describe or to accept a wrong idea the mother is talking about. Demonstration B, you can find it in your manual at page 40. This is another scenario. Accept what the mother feels. Okay, the previous one was accept what the mother think. She think that she need formula. The feeling now. The health worker meeting the mother. Good morning, Hind. How is feeding going for you and your baby Noura? The mother in tears. It is terrible. My baby nose is completely blocked and she cannot breastfeed. She just cries. I don't know what to do. So the mother is needing help now. So let us see these responses. Is it acceptable or not? So did I accept her feeling? Don't worry, your baby is doing very well. So now I criticize this mother and she's worried and she's in tears. If I say don't worry, next time she don't know when to worry. So I have to accept her feeling that she's worried. Don't cry, it is not serious. Your baby will be soon better. So this response also wrong. I have to understand her feeling. The last one is, you feel upset about Noura, don't you? Okay, I describe what she feels now. Now she will be relaxed. Now she will talk more about it. So we are using empathy here to show the acceptance, and this is the appropriate response. Okay, don't say the mother, don't worry, don't cry, because she will lose her confidence. She don't know when to worry and whether she's not judging her situation. We finish from the skill number 1. It is the acceptance. Now skill number 2, recognize a good practice that the mother is doing and embrace that, because we are doing in stages for counseling. After the stage of accepting all what she's saying and using our listening and listening skills, so that I will take more of her, give her open question to take more of her information. Then I will start now. I know her situation, what is the wrong she's doing. Before I give her any information, I have to brace her so that she will accept from me. If I accepted her feeling and her thoughts, if I brace her, after that she will be open for my advice. So now the second skill is to brace a mother. So try to find anything the mother is doing right and brace her for that. يعني she will be happy if you brace her, if you يعني إذا مدحت الأم حاولوا تمدحونها عشان تقبل منكم النصيحة بعد كذا. It build, what is the benefit from bracing the mother? It will build the mother self-confidence, and this is what we want. It encourage her to continue those good practices that she's doing. And she will be open for your suggestion later on. We will have an example, a new mom. If a new mom, how can you brace a prime gravida and she's taking of her baby? There is a lot of things that you can brace a new mom, because everything she's doing is new for her. New for her to take care of baby, new for her to clean a baby, to change diaper, to put a baby to the breast, even if it is wrongly putting, but to put the baby to the breast. This is a new thing that she's doing, and she's practicing a lot of new things. So a new mom, I can brace her for anything she's doing. A working mother, if a working mother I want to brace and she came to the clinic, I will brace her for continuing breastfeeding. Even she bought a bottle, but she's still continuing breastfeeding. I can brace her for exclusive breastfeeding also if she's exclusively breastfeeding. I can brace her for night feed. It is very important, night feed, to build up the milk supply. If you meet a mother in the clinic, how I brace her for that? I brace her for just coming to seek help. I will brace her for that. Also brace her for the eye contact with the baby. So a lot of things, you try to find a thing to brace the mother before you give her the information. This is the second skill. Practice a scenario in bracing a mother. So this mother had returned to work shortly after her baby was born. And she's expressing breast milk during the day on her work, and the baby stay home at work. And she continued to breastfeed at night. And she's worried whether her milk is enough for the baby or not. And she's wondering. So let us see what she said. I am expressing milk during the day for him while I am at work, and I breastfeed him at night. Am I breastfeeding enough? Okay, now I have to support her. How to support this lady? We will see some responses. We will see which responses is most helpful in her condition. You need to breastfeed your baby more often. Oh, this is an order. I cannot say that. It is better to breastfeed your baby rather than giving your baby a bottle during the day. Okay, this response is not helpful. It is good that you are continuing to breastfeed and you're continuing breastfeeding your baby at night. Okay, this is a good for bracing. So I brace what she's doing. She's continuing breastfeeding. And also another thing you can brace her, that she's expressing milk at work. Skill number 3, after I brace her, after I accept her idea, I will give a practical help. Practical help that you can judge it according to the situation of the mother. A mother needing a practical help to keep her relaxed. If she's not in a relaxed position, I can help her. I have to keep her relaxed in a comfortable position so that this will help the milk establishment and production. If she's in pain, this will affect her milk production. And it will also help the mother to focus in her baby if I help her. We can list some of the practical help that you can give to the mother. It's according to the situation. This is an examples of a practical help you can give to the mother. Making her comfortable, giving her a drink, because maybe shortly after labor you meet her, she's thirsty, she's hungry. You can give her a drink and you can provide her with something to eat. You can hold the baby for her. Okay, if she needs help to hold the baby, you hold for her so that she find a comfortable position to change her position, to change clothes, or she want to go to the toilet. So you can help her with this thing if she accept you that you hold her baby. You can support her by pillow. Okay, I put a pillow beneath the baby if she's sitting. If she's in bed and she sit in bed and the bed cannot bend at the knee position, I can put a pillow beneath her knee. I can put a pillow at her side if she will breastfeed outside. If she's side lying, I put pillow at her back. So I can use a pillow to support her comfort. I can adjust the bed for her. If the bed is electronic or manual, I try to adjust for sitting, for raising the feet. Also ensure privacy. She will not breastfeed while everybody is watching her. I ensure privacy and close curtain. So you just, it is according to the condition of the mother, to the situation. You figure out what help you can give her before you give her the advice. Okay, this is a scenario. This mother, she just came from labor. She's lying in bed soon after delivery and she looks miserable and depressed. She is saying to the health worker, "No, I haven't breastfed my baby yet. My breasts are empty and too painful to sit up." Okay, so I have to figure what help I can give. Let us see some responses. Okay, the first response this is practicing how to give a practical help. You should let your baby suckle now to help your breast milk to come in. Okay, this is not a practical help. This is advice, and it is not a good advice. The second response, let me try to make you more comfortable, and then I will bring you a drink. Okay, this is a good practical help. I put her in a comfortable position. I give her something to drink or to eat. This is a practical help. Skill number 4, provide relevant information. Now you can give your information. You see all of the thing we did, the skills to prepare the mother to get your advice. So now you must give information relevant to her, to the mother's situation at that time. And your information should be related to what she needs at her situation. Let us have examples. After labor, the mother breast is soft, and she may think that there is no milk. So what advice can I give her shortly after labor? I can give her information like the amount of milk in your breast is enough for your baby. His stomach is tiny. He needs no water, nothing else than your milk. So I give her information about the stomach of the baby, and I know that her milk is very low, very little, and it is enough for the baby. And also I give her information about exclusive in a short way. This is all the information that she needs shortly after labor. If you meet a baby at a baby 2-month-old in the Will Baby Clinic, what talk you can give to mother information at this time? I will talk about growth spurt, because around 2 months, 3 months, the baby will have a growth spurt and he will cry a lot because he needs more milk. So the mother at this time, 2 months, the mother usually will go to work and the baby will have a growth spurt. And this is the time where most of the ladies start their formula at 2 months. So I have to catch her, give her information to support her in this issue. So I will tell her that the baby will have a growth spurt and he will cry a lot, but he needs to have breastfeeding frequently. You just put him to breast every now and then, every time he needs, so that your milk supply will increase and your milk supply will fit the baby need. So she have to know that she have to increase more so that her supply increase to fit the baby. Not to give a formula because her supply is still not enough for the baby is growing, because the baby is growing. So we correct this information at this time is very important. Then if you meet a mother, for example, at 4 months, baby is 4 months old at a Will Baby Clinic, what you will talk about? We should talk about complementary feeding, because some mothers will start at 4 months. I should tell her complementary feeding start at 6 months and what to give. She should give a food cooked at home, and you will have explanation later on this issue. If I'm a working mom, at end of her maternity leave, I met her. She came for contraception like that in a postnatal visit. So I will talk about milk expression and storage and how to continue breastfeeding. So this is a situation where you can help the mother and when to give a relevant information to her situation. Skill number 5 is to give a simple language. So try to make it simple for the mother to understand. Use a simple, familiar terms. Avoid using a medical terms. We'll have a scenario here to show you what is the difficult scenario for the mother to understand and what is the easy one. A health worker, good morning, Huda. How is breastfeeding going for you and your baby? The mother, it is going okay. I am going to start giving my baby a formula because I hear that it protects against infection. Okay, maybe she saw a brochure about formula that it boosts the immunity and it is misleading, or somebody told her the immunity will be better with the formula. So how to give her the information in a simple language? Okay, the health worker said, Breast milk is filled with anti-infective factor and immunoglobulin that provide your baby with protection from viral and bacterial infection. Artificially fed babies get diarrhea more often, partially because artificial feed lack the anti-infective factor, and artificial feed are often contaminated with harmful bacteria. If you give your baby breast milk, you will benefit from anti-infective property and immunoglobulin secreted through your breast milk. Okay, I think it is clear now why we don't want to use a lot of information and a lot of medical term for the mothers. Let us see the other response. Okay, this is not helpful response. A health worker, good morning, Huda. How is feeding going with you and your baby? The mother, it is going okay. I am going to start giving my baby a formula because I hear it to protect against infection. Okay. The health worker, what do you say? You are wondering about what is best for your baby? I am glad you come to talk about it. Your breast milk will help protect your baby from infection, but formula will not. If you feed your baby a formula, he will have less protection against illnesses. Okay, you see this response, a very good response from the health worker. We will list what skills he used. He used a lot of skills. The first one, okay, the first sentence, let us see. You are wondering about what is best for your baby. Okay, now this is accepting. Empathy. I understand what she's worrying about. She's wondering. So I accept and use empathy to accept what she said. Okay, the second thing, I am glad you have come to talk about it. What is this skill used? I used brace. Okay, I brace the mother because she came to talk about this thing. She shared me this information. Okay, I brace her. Then I accept what she said. Then I brace. Then I will give a short, relevant information with not complicated, a simple, familiar language to the mother. So the second, your breast milk will help protect your baby from infection, but formula will not. And if you feed your baby formula, he will have less protection against illnesses. So we are in favor of the second response. Skill number 5. Okay, use simple language. No. Skill number 6. Make 1 or 2 suggestions and not command. This is the last skill. I will give her suggestion and not command. What is the difference? So provide the mother with choices relevant to her situation and let her choose what suits her. Okay, I will give her a plan. So the suggestion is an idea or a plan to consider in the future. And command, it is information given as an order. Do this, do not do this. Let's see, practice here. What is the command and what is the suggestion? You must feed Ahana at least 10 times a day. Okay, this is a command or a suggestion. This is an order. It is a command. The second response, it might help if you feed Ahana more often. Okay, this is a suggestion. She will take this as freely. Yani. It might help if you feed Ahana more often. So this is a good response. We will practice now these skills that you have. We will practice one by one. So I need you to open your manual at page 45. We will have the exercise 4A. Okay, the exercise is to draw a line from the response to choose. Is it agree, disagree, or accept? We will have an example. Okay, example, the mother, I give a drink. I give a drink of water if the day is hot. So this is the responses, and we have to see which is one is favorable and accepting. The first response, that isn't necessary. Breast milk has enough water. So this response is disagreeing. The second response, yes, baby need water in hot weather. So this response is accepting, agreeing with a wrong idea. Then the third response, you feel the baby needs some water if it is hot. This is accepting. I accept her idea. So we will have here practice and to choose, is it agree or disagree or accept. The mother scenario, my baby has diarrhea, so I am not breastfeeding until it is gone. Okay, the responses, the first one, you don't like to give breast milk now? Okay, this is accepting, right? So I just frame what she said. This is accepting. And it is quite safe to breastfeed when he has diarrhea. What is this? I am disagreeing with the mother, right? It is disagree. The third response, it is best to stop breastfeeding during diarrhea. Okay, this is wrong. This is agreeing with the wrong idea. So it is against breastfeeding. If she stops breastfeeding, what she will give? She will give formula. Okay, let us practice the third one. The first milk is not good, so I will need to wait until it has gone. So this mother disliked to use the colostrum. She wanted to go it had gone. So what is the responses? The first milk is very important for the baby. Okay, now I disagree with her. Second response, you think the first milk is not good for the baby? Okay, now what? I just explain what she said. I just frame it. So this is the good response that she's accepting. You think the first milk is not good for your baby? This is the right one. The third response, it will only be a day or two before the first milk is gone. So I agree with incorrect idea, and this is wrong. Okay, this is practicing accepting what the mother or caregiver given. We will move to the second exercise. It is page 46. Recognizing it is bracing the mother. How to brace a mother. Okay, we will have example and then we will do the exercise. A mother had to return to work shortly after her baby was born, and she expressed breast milk during the day to give to the baby while she's at work, and she continued to breastfeed the baby at night. She's worried that she is not breastfeeding enough. So what is the response for me? The normal response, the good response. It is good you are still continuing breastfeeding at night. Not using the word still, yani, as it is difficult. No, it is good that you are continuing breastfeeding at night. So this is bracing. I took brace from the scenario. A statement to brace. Okay, story A. A mother of 2-day-old baby tell you that she is worried her baby is not getting enough milk, and her mother has told her that the baby is crying because he is thirsty and need water. Okay, I have to brace her for something. I will say, what can I say? What is good thing that she's doing? The baby is 2 days old. She didn't start water, but she's telling you. So I will tell her, good that you are only giving your baby breast milk, because she didn't start. Good that you are only giving breast milk. Then I will give her the information after bracing that the breast milk is all what the baby need, and it satisfies the thirst of the baby, and it have the formula, it have 70% water. So brace and then give her information after that to support her with the information after bracing. Story B. You are taking care of a new mother and her baby, and she tells you she is breastfeeding, but her family said she needs to start giving the baby a bottle right away so that she get used to it. We are facing this problem a lot. Most of the ladies, they want to start formula because they said, I want him to get used to it just in the future if I need. Okay, if you need, you teach her. If there is no need, you just continue. You should continue breastfeeding. So what response? I should brace this mother because she's breastfeeding. I will tell her, it is good you are breastfeeding your baby and not using a bottle. So now she understands that it is good not using a bottle. And I brace her in the same sentence. So it is good you are breastfeeding and not using a bottle. This is examples of bracing. We will have now an example to exercise 4C, provide relevant information and simple language. Okay, we will have an example. Colostrum is all your baby need in the first few days. The first yellowish milk that comes in is exactly what your baby need for the first day. So on the right side, it is a difficult word or using medical terms, and then I will turn it into a simple language. So the simple language for colostrum, it is, I will say, the first yellowish milk or the first milk in the first 3 days. Yani it have a definition, a simple definition. Exercise, exclusive breastfeeding, provide all the nutrient that your baby need for the first 6 months. So this is about exclusive breastfeeding. So the mother may not know the term, what is the meaning of exclusive breastfeeding, how I can explain for her exclusive breastfeeding. I can say breastfeeding alone is all your baby need. So this is exclusive. Breastfeeding alone is all your baby need for health and growth in the first 6 months. So this is a simple language. Let us see the other example. Immunoglobulin in human milk provide your baby with protection from viral and bacterial infection. Okay, she will not understand what is immunoglobulin. So using a simple language, what I will say, your milk help protect your baby from illnesses, full stop, and that's it. So I will tell her, your milk help protect your baby from illnesses. No need to tell her about immunoglobulin. Now we will do exercises about suggestion and command. So what I will do, I should give the mother suggestion and not a command. So he will give you a command and then you will frame it to reframe into a suggestion. Do not give your baby a drink of water. So how can I frame it? We can say, have you thought of giving only your milk? So that instead of saying, do not give water. Now we will have the exercise. You must feed your baby more. So this is an order. you must feed your baby more. I need her to breastfeed more often. So what I will say, do you think you could feed your baby more often? Okay, this is a suggestion and it is information. So now she think of you give her an order, but she thinks she have the freedom to do it. If you put it like that, do you think you could feed your baby more often? The other example, do not give any food to your baby until after 6 months. So instead of using the word do not give, it is a command. So how can I frame this sentence to her to tell her about to start food after 6 months? I will tell her most of the baby do not need other food or water until before 6 months or until they are 6 months. Can you try that? I will tell her, can you try that? Most of the baby do not need any food or water before 6 months. Can you try that? Okay, this is just, I give her information that no need to give complementary food or water before 6 months. Then we will have a summary. This is a summary of what we did in the previous slides or the slides. So you finish listening and learning skills, 6 learning and listening skills. The 6 building confident and giving support skills are to accept what the mother or the caregiver or the parent think and feel, like accept what she think and what she feel. Skill number 2, recognize a good practice that the mother is doing and praise her for that. Third one, give a practical help. Fourth one, provide relevant information for her situation at that time. Fifth one, use simple language. And this relevant information should be in a simple language. Sixth one, give such a suggestion and not command. So this suggestion, it is the future plan for her, how to deal with her problem. And don't forget also to give her a follow-up after this suggestion, after counseling. Try to be in contact with this patient. Open the door for her, let her come as walk-in or use an extension for her to have support, and give her a follow-up to see what she's doing, and let it be a close follow-up, like come tomorrow, come after 2 days, because it is crucial. Really, you know, you have to be sure that she is protected from starting formula. She is really supported good and she doesn't need anything. Thank you. I just finished my session, and if you have a question, please write it, and by the end of the day we will answer all your questions. Thank you.
Yeah, thanks, Dr. Faiza, for the continuation of counseling skills. Now, Dr. Mariam and Dr. Faiza complete the counseling skills, listening and learning, and building confidence. We hope that this course interactive for face-to-face, but inshallah, soon it will be interactive session. There is one questions. One participant asked about the timetable for today. Actually, timetable sent for all participants through the email. You can check your email. If you don't have, we try to write the link for timetable in the chat so anyone can reach to the timetable. Now the next speaker, Dr. Wafa Fallata. She is a lactation consultant and she's a family medicine consultant. You will enjoy the lecture with Dr. Wafa Fallata. She will talk about how breastfeeding works. You can start, Dr. Wafa.
Okay. Hello, good morning, everyone. Thank you for attending this beautiful course. And if anything, it means that you are very much interested in well-being of mothers and babies. And it's actually our pleasure, and we are so proud that we can conduct such a course, although of the situation, the Corona situation. This is the first time for us to have it online. Obviously, your feedback will be very important to us. We want to know if we can conduct such courses in the future again online. So please make sure that you give us your feedback. In this session, I will be talking about how breastfeeding works. The objectives of our session is we will together go through the parts of the breast which are involved in lactation and their function. And then we'll study the physiology of the lactation hormones and the physiology of breast milk production and flow, and the differences between good and poor attachment of a baby at the breast. These may be new terms for you, but they are extremely important in the process of breastfeeding, good and poor attachment, and we will tackle both with pictures. And we'll be talking about the 4 key points of attachment, and we'll be talking about the suckling action of the baby when well attached or poorly attached. Oh. By knowing how breastfeeding works, you will be able to help mothers, parents, and caregivers to breastfeed more successfully. You have to know the dynamics. You have to know what's going on, what happens until the milk gets into the baby's mouth. This deep understanding will help you, and I will tell you throughout as we are going some of the points that mothers will complain about and say that they cannot breastfeed because of this and that, and how you can explain the information to them, correct their misconception or misunderstanding, and help them have a successful breastfeeding. So we will study the anatomy and the physiology of breastfeeding, and we will discuss the milk production and milk transfer. This slide shows you the different parts of the breast. We'll show you the anatomy of the breast. Let me try and see if I can put the... As you can see here, this is the nipple, of course. And the areola, this is the areola, which is the dark area around the nipple. The size of the areola is variable. Not all women have the same size, and sometimes you will be surprised of how small, sometimes up to here only, or how large the areola can be. But it's the dark area around the nipple. We have what's called Montegombly glands. These are small projections in the area. The number is variable, between 15 to 20. These are glands actually, so they produce oily fluid to keep the skin healthy. But more importantly, they produce a substance that has a certain smell, a specific smell. And this specific smell is specific to every mother. It's different from one mother to another. It is this smell that makes the baby recognizes his mother. So this is why it's very important. Now, some mothers, what they do when they want to breastfeed, they wash the breast. They bring a towel, wet towel, and they keep washing the breast because they are thinking this is hygienic. But what happens is they are eliminating this smell, so the baby cannot recognize the mother. We have these small sacs. These are alveoli. This is one which is enlarged. Now, the alveoli are made of cell-secreting cells, and they are millions. طيب. The box here shows only 3 of these enlarged. Huh? They are extremely small, actually. The hormone called prolactin makes these cells produce milk, and we will be talking about this in detail. Okay, so they are the milk-secreting cells. The alveoli consist of the milk-secreting cells and of muscle cells. They are muscles, but they are in the form of cells, so they are very small. And the reason is because they do contract around the milk-secreting cells to produce milk in response to a hormone called oxytocin. So milk-secreting cells are affected by prolactin to secrete milk, while muscle cells are affected by oxytocin to help them contract and so transfer the milk. The ducts, these are the ducts, they are small. They carry milk from the alveoli all the way to the nipple. Between feeds, the milk is stored in these alveoli and in the ducts. And these ducts, eventually, they are so small at the beginning, and then they merge and they become larger, and they form around 7 to 10 larger ducts that pass through the nipple. So actually, the nipple doesn't have only one opening, as so many people think. There are several openings. It could be up to 10 openings in the nipple. The larger ducts beneath the areola, what happens is they dilate during feeding with milk. They are filled with milk during the feeding. And then when the baby's mouth goes in and the tongue goes under, and as we will be talking about in a minute, it will extract the milk which is stored in these ducts. In between the alveoli, we have what we call the fat and supporting tissue in between alveoli. Okay, now what makes breast variable, you know how many breasts can be small, can be large? The difference between a small breast and a large breast actually is the amount of fat. The glandular system, which is the alveoli and the smaller ducts and the large duct, is more or less the same in all breasts, in all women. What makes a difference if a breast is large or small is actually the amount of fat. If it's more, then the breast will be large. Supporting tissues, this is what we call connective tissue. When you hear some women say that they have sagging boobs, they say breastfeeding causes sagging of the breast. This is not accurate. The sagginess is related to the amount of supporting tissue present, and this is genetic purely. It has nothing to do with breastfeeding. Breastfeeding happens in the alveoli, the ducts, and the larger ducts till the nipple. So it has nothing to do with how the breast looks, nothing to do with sagging. This can help you correct this misconception. Women sometimes refuse to breastfeed because they say that breastfeeding will make their breast or boobs come down and they don't look nice. So it has nothing to do with it. Okay? Now, we will be talking about these hormones, prolactin and oxytocin. They are important hormones. Now, in general, if you don't know, I think fairly everybody here is actually in the medical field. But even if you don't know, the hormones are chemical messengers in the blood. They help control and regulate different processes in our bodies. We have so many hormones in our body. Each has its own specific action. The first stage of milk production is under the control of hormones. Actually, I don't know if you know this information, breast production starts during pregnancy, actually, in the 14th week of pregnancy. Actually, it doesn't happen in the first few days after delivery. No. Hormones of pregnancy, which are estrogen and progesterone, help the breast to develop and grow in size. This is why if you notice all women who are pregnant, they have larger breasts and they become heavy and they feel congested. And they start actually making colostrum very early as 20 weeks of pregnancy. This is why it's really readily made. It's there. It's available when the baby is immediately when the baby immediately is born. Then the colostrum is available already. So it doesn't happen at the exact time of delivery. No, it is synthesized from before. Now, after birth, these hormones, estrogen and progesterone, decrease in amount because the baby is not there anymore. So now the two hormones, the prolactin and oxytocin, take the upper hand. They start working. So during pregnancy, milk production is governed or controlled by pregnancy hormones. After delivery, the milk production is controlled by hormones and by another mechanism I will be also talking about. But firstly, by hormones, prolactin and oxytocin. طيب. Here, this slide will be talking about prolactin hormone. It is important to start milk production and delivery and to sustain milk production. How? During pregnancy as well, prolactin is very high actually. But why milk doesn't come in if milk is very high in amount, as if prolactin is very high in amount? Because it is suppressed by progesterone and estrogen hormones. So it really it cannot work. It cannot make the cell secrete milk. But after delivery, we said the pregnancy hormones decrease in amount, so the effect, the blockage that they exert on prolactin is not there anymore. So prolactin takes the upper hand and starts working. It makes milk production increase immediately after delivery. Whenever mother and baby are skin to skin, milk prolactin production increases. This is very important fact. This is why we insist on skin to skin contact immediately after delivery, because of this fact. Prolactin level actually increases when the mother is having her baby on skin to skin contact. This is something you can tell the mother, so to tell them that this will also help milk production. After 2 to 3 days postpartum, a mother notices that her breasts become full. At the beginning, they are a little bit soft. Sometimes it worries mothers. In the first 1 to 3 days after delivery, the breasts are soft. They are not full. Mothers will say, we don't have milk. But actually, they're not supposed to have mature milk. They only have colostrum. They become only full when it's the 3rd day, as colostrum transits or changes into what we call mature milk. We say the milk is coming in. It is this time when the milk supply increases. Now, prolactin, what it does, it actually sustains milk production. What happens is, when the baby is suckling at the breast, there would be nerves carrying sensory impulses going from the breast all the way to the brain, to a gland in the brain, which is called pituitary gland. Now, this pituitary gland produces prolactin. Prolactin goes from the gland to the breast and makes the milk secreting cells start secreting milk. Now, prolactin, even after feed, is there in the blood for 45 minutes, which is weird. Now, the feed finished. So why prolactin is still there for 45 minutes after the feed? The reason is it's preparing for the next feed. Imagine. So it starts secreting milk, but actually is preparing milk for the next feed. So then why the baby from the same feed or the present feed is actually what is the baby taking at the same feed is actually milk that has been produced early on, and it was stored in the alveoli and the ducts. Prolactin comes to prepare for the next feed, to convince the cells, the secreting cells, to start working and produce milk. Okay, this is an important fact. So how to increase the milk supply? It means that based on what we have said, we advise babies to suckle a lot from the breast. This is why we want the mother to start breastfeeding after delivery for 1 hour or half an hour to 1 hour immediately after delivery, because we know this suckling is the greatest stimulus for milk production, because it will go to the brain, tell the pituitary to produce prolactin. Prolactin comes to the breast and make the cells work hard to produce milk. So if we want to increase milk supply, a mother who complains skin to skin, immediately start breastfeeding, immediately put the baby to the breast so that the baby will suckle. If the baby doesn't suckle enough, the prolactin levels actually go down and the breast become or make less milk. The first month to 2 months after delivery, this is very crucial, because the body of the mother still doesn't know, the breast doesn't know how much the baby needs from milk. So if we don't regulate this from early on, the milk production will be less. So we have to explain to the mothers how important to put the baby often to the breast, not to bottle feed. So more prolactin is very important to know that more prolactin is secreted at night. A lot of mothers, what they do, they breastfeed during the daytime, and at nighttime they will give the baby bottle, and they say that makes him more full, he will be sleeping more, and I will be sleeping more. But what happens is actually they are affecting or harming breastfeeding, because prolactin is secreted more at night. So if you do know this fact, this is one of the things that you also help mothers when they say they have less milk production, tell them breastfeed more at night because there'll be more prolactin. Prolactin makes a mother feel relaxed and sometimes sleepy. So actually, it's been said that it goes to the respiratory cardiovascular centers in the medulla, in the pontine or pons, and it makes the mother reduce the heart rate and reduces the blood pressure and reduces respiration. So it gives her sort of relaxing effect. So actually, breastfeeding at night makes her more relaxed, and she will rest well if she breastfeed at night. Okay, let's talk about oxytocin. When a baby suckles, again, there will be sensory impulses going from the breast all the way to the brain to the pituitary gland. And then the pituitary gland will release oxytocin, which will go to the breast. And what it does, as we said before, if you remember, we said he will go to the muscle cells around the alveoli and make them contract, and then make the milk which has been collected in the alveoli go to the ducts, and then to the larger ducts, and then to the nipple. This is what we call the oxytocin reflex. It has other names. Some people call it the milk ejection reflex. Some people call it lid down reflex. Nevertheless, it's the oxytocin reflex. So what happens as milk is produced, those larger ducts, remember the one that I showed you in the first slide, they will dilate, they will swell with milk, and then the baby will exert its action when it starts to suckle, and the tongue goes under these ducts and then start extracting milk from the breast. So which means oxytocin enables the baby to get the milk. It is produced more quickly than prolactin, actually. So makes the milk in the breast flow for this feed. So when the mother is breastfeeding now, oxytocin comes to release the milk which is already made for this feed. Prolactin comes at the same time, but it stays for longer because it's preparing for the next feed. Where could you have this done if you're doing bottle feeding? Compare this normal physiology, which is easier. It's not something that you do or you think about. It just happens, to preparing bottle feeding and boiling the water and all the action that's needed from sterilization and all this. So again, if you tell the mother this, actually this will make her life easier. Now, oxytocin is called the love hormone. They say women who are breastfeeding have better mothering. Oxytocin encourages mothering of mothers to their feelings or their bonding with their babies is actually more. We don't mean that mothers who are bottle feeding, they don't have a good bond with their babies, but we mean they have a deeper connection with each other. And when we tell this information actually to mothers who have babies and they breastfed and bottle fed different babies, they will tell you yes, they can feel that there is an extra link or extra connection with, or a deeper connection with the baby who they breastfed. And this is why actually they say women who are breastfeeding, the rates of child abuse or child neglect are much less. The rates of postpartum depression, because we remember when we said that prolactin causes relaxation and oxytocin makes her love the baby more, so the rates of postpartum depression are actually, by studies, are less in mothers who are breastfeeding. Now, here we are talking about how oxytocin is, how to help mothers when we recognize certain factors that can increase oxytocin or certain factors that can decrease oxytocin. Now, when a mother is worried, when she is stressed, delivery is stressful. If she has another 3 or 4 babies waiting at home, she needs to do her housework, she is stressed. If she's in pain, especially if she has an episiotomy, if she has cesarean section, or if she has doubt, even if she has doubts about herself or her ability to breastfeed, then all these facts actually do hinder the reflex, makes oxytocin reflex less, make milk production less. This is very important for you as a breastfeeding advocate to recognize so that you can help such mothers. So if she is worried, if she's in doubt, try to alleviate her worries and her doubts. If you can help her, if she is stressed, suggest things. Talk to the husband, talk to the other person who is supposed to be with her, maybe her mother-in-law or her own mother. If she's in pain, give her analgesia, help her. Because you know, if you decrease these factors, then at least oxytocin reflex will improve. Another thing that helps mothers to actually improve oxytocin reflex, and I think all of us know it. If everybody here speaks Arabic, I think there is a term we say صدري حن. A lot of mothers, when she's at work and her baby is at home and she's thinking of the baby, she will start feeling tingling in the breast and then milk will start dripping out. Or she hears the baby crying, then her milk will start dripping out. Or she's preparing for breastfeeding. She didn't put the baby yet to the breast, but she's about to, then she can start having milk coming out. If some of you breastfed, you also have noticed these things. Because if you think lovingly of your baby, if there's sounds of the baby, sight of the baby, or touching the baby, all these will help increase the reflex. This is very important to you as a breastfeeding advocate because if a mother comes to you and tells you that I don't have enough milk, or I want to express or try to express, I couldn't do it, especially if she goes to work, tell her, have a recording for your baby's voice when he's crying, or have a picture of your baby, or a piece of his clothes that has his own smell, it's not washed. These things will help you produce milk. Confidence, surprisingly, in her ability to breastfeed is actually something that can help oxytocin reflex. This is also where you come as a healthcare provider or as a breastfeeding advocate. You have to build her confidence in her ability to have. This is why we start this education for mothers during antenatal period, so that we have enough time to talk to them and convince them of all the facts that we want to convince them, and they are so ready because they are very much caring or thinking about their babies. So they observe the information that you will give them, and that you will help her and support her. Sorry, and you tell her that you will help her and support her. You'll be there for her when she faces any problems and try to solve them for her after delivery. Then this will build her confidence and her ability to breastfeed. This alone will improve her oxytocin reflex. Okay, now sometimes mothers are aware of their oxytocin reflex, But there are several signs of an active reflex that they or you as a breastfeeding advocate or breastfeeding or lactation management counselor can notice. These are the signs and sensations of oxytocin reflex. Some mothers can experience squeezing or tingling sensation in her breast just before she feeds her baby or during the feeding. Or there is milk flowing from her breast when she thinks of her baby or hears the baby crying. Or milk dripping from her other breast when her baby is suckling. She puts the baby to one breast, but milk starts dripping from the other breast. Or that milk flowing from her breast in fine streams if her baby comes off the breast during a feed. She finished breastfeeding, she took him off the breast, but milk is still coming out. Or if she has pain from uterine contractions, because oxytocin, we said it goes to muscles and convinces them to contract. So it goes to the muscles in the breast, but it also goes to the muscles in the uterus, causes it to contract. Sometimes while a mother is breastfeeding, she will experience some pain. They call it after pain. Some mothers will refuse to breastfeed because of this pain. But actually, if you know this information and you know that these uterine contractions means less blood, and it means that the uterus will go back to its original position faster, when you tell her this information before she starts breastfeeding, while she is on her antenatal antenatal classes, actually this will help her convince her to continue breastfeeding, because some mothers will stop because of this pain they're having. Okay, so actually it decreases her amount of blood or bleeding, and it makes the uterus goes back to its original position early on. If the baby is having slow deep sucks and is swallowing, it means that the breast milk is flowing into the mouth, and this is why he is swallowing, right? So all these are oxytocin reflex. Now, reflex signs or sensations. So if a mother tells you, I don't have enough milk, or I'm not producing enough milk, you can ask her about all these signs. If she has them, this is a way for you to convince her that actually you do have enough milk. Something else is going on. We will address it. We will try and see it, but you can convince her. Okay. Now, some mothers may not have any of these symptoms, but still they will have an oxytocin reflex. She may not have any feeling of pain. It doesn't mean that her reflex is not active. As long as the baby is taking the milk and the baby is growing well, it means the baby is taking enough milk. It means that there is an oxytocin reflex. So she doesn't have to have always, all the time, squeezing or tingling sensation in the breast. Okay. Now we'll be talking about Dr. Phil. I like to call him Dr. Phil. He's an inhibitor in the breast milk. It's a protein present in the breast milk. What it does, this is a sort of auto-regulation of milk production. Remember, we talked about the control of breastfeeding production during pregnancy, estrogen, progesterone, after delivery, prolactin, and oxytocin. Within the breast itself, there is also an auto-regulatory factor called an inhibitory protein inhibitor in breast milk. What happens is, if we have the breast full of milk, this inhibitor will be released. It will go to the secretory cells, and it will convince them to stop secreting milk. Why? It's a sort of protection, because there is only a certain capacity for these cells or these alveoli, how much milk they can hold and how much milk they can store. So they cannot keep secreting milk, and then they might go into engorgement and all that, because breast milk will ooze into the surrounding tissues and will cause sort of inflammation. So as long as the breast has a lot of milk, this factor is there in a large amounts. We call it feedback inhibitor of lactation. Okay. Now, if the milk is not removed and the breast is full, this will mean there will be decrease of production of milk. If the mother breastfeeding regularly, this inhibitor will be removed by breastfeeding. So it will go in the milk, it will go out. Once it goes out, the cells will be aware that there is no more ductal fill, so they will start secreting again. Okay, this is very important to know. High levels of this inhibitor, it means there is no secretion of milk. High levels are available if there is a lot of milk in the breast. As much as we remove from the milk from the breast, then this inhibitor will be also removed. So secretion of milk will resume. So if a baby stops suckling from one breast, the breast stops making milk. And actually, this is the basis of why when some mothers prefer to breastfeed from one breast compared to the other, after some time, the production of milk stops actually in the other breast that they're not breastfeeding from. Although we are still having prolactin and oxytocin. So this is the explanation. The other breast will be large and it will be full of milk and will be dripping milk. But the one that she stopped breastfeeding from, there is no milk and it becomes soft and the size decreases. It's because of feedback inhibitor of lactation. So it has to be removed, this inhibitor, in order for the process of milk secretion to continue. If not by the baby, then by expression. So even if the baby is not taking the milk for whatever reason, if you want milk production to continue, then you have to remove the milk by any means. In this case, we mean expression. We'll be talking, I think we have a lecture about expression within the course. So we will be talking about more about the expression. Okay, so milk production is actually a responsive process. And we say responsive process, as we say in trading, the higher the demand, the higher the production. It's the same thing. It's a responsive process. The mother's body makes as much milk as the baby drinks. For a mother to produce enough milk, her baby must suckle often and remove the milk. So to remove and transfer the milk, it is necessary for the baby to suckle effectively. Okay, so to maintain production, the baby has to suckle. The baby has suckle effectively, only then milk production will continue. What do we mean by suckling effectively? We'll be talking about this now. This is very important thing that we'll be talking about, attachment to the breast. If you haven't heard from before this term, it's new to you, fine, we will be talking about it in detail. This is a very important concept or a term in breastfeeding process on lactation management. We see this baby taking the breast into the mouth to suckle. Right. What we can see that much of the areola, I don't know, we'll see it here. Much of the areola, the underlying tissue, is inside the baby's mouth. The larger ducts, these are the larger ducts, are included. The baby has stretched the breast tissue. If you can see this, all this is the nipple. But this is not the way the nipple looks in real life. When it goes to the mother's breast, to the baby's mouth, it becomes elongated a little bit, and we call it a teat. The nipple is only 1/3 of the teat. The rest is made by the other, the areola and the larger ducts in the areola. The baby is suckling from the breast, the whole breast, not just the nipple. So the baby is not taking only the nipple; it's taking the larger part of the breast. And this is why we say this is breastfeeding. It's not nipple feeding. Okay, this is why we say nipple feeding, breastfeeding, not nipple feeding. This is a very important concept. Now, I want you to notice the position of the baby's tongue. This is the tongue of the baby. The tongue is moving forward over the lower gum. This is the lower gum of the baby. So the tongue is moving forward and is going beneath the larger ducts. It's beneath. This is why when a baby cries, when a baby is crying a lot, the tongue will go up usually with crying. So you cannot breastfeed a crying baby. That's why we need mothers to identify hunger cues or feeding cues before the baby starts crying. Because once he's crying, you cannot really breastfeed because the tongue goes up. You need the tongue to be down, going forward over the lower gum ridge, underneath the larger ducts. And the baby tongue is cupped around the teat of the breast tissue. It goes around the teat of the breast tissue. Of course, we cannot like exactly see it here in this slide, but it goes around them. Okay. So if the baby takes the breast into the mouth in this way, we say the baby is well attached. I will be talking about this. Okay, so notice this here. We say the baby's mouth or the tongue actually forms a wave. I don't know if you can appreciate it in this slide, but it forms a wave. It's not the same as the previous slide. Look at this. It's not exactly like this. When the baby is actually suckling, it's in motion. And actually, you can see it in ultrasound. They do ultrasound while the baby is breastfeeding, and you can see this peristaltic movement. It has actually 3 waves that happen, and they move along the baby's tongue from the front to the back. The wave presses the teeth of the breast tissue. Where is the, yeah. The teeth of the breast tissue against the baby's hard palate. So this action from the tongue presses the teeth against the hard palate. This action presses the milk out of the larger ducts into the baby's mouth, from where the baby will start swallowing. So the baby doesn't just simply suck milk out of the breast. It's not like drinking from a straw. It's a little bit complicated process, but the process happens without the baby feeling it or knowing it or understanding it. And even the mothers don't realize how many parts are involved in the process of breastfeeding. So this is very important for you to know, that we have a peristaltic movement of the tongue, and it presses the larger ducts against the hard palate to press the larger ducts and then release the milk into the baby's mouth, and then the baby can start swallowing. This is called effective suckling, when the baby is well attached. The mouth and the tongue will not be rubbing against the skin of the nipple, so they don't cause soreness of the nipple. See, because it's far away, the nipple is inside, so the tongue here and the mouth, the lips are not rubbing on the nipple itself, so they don't cause soreness of the nipple. Okay. We usually conduct this not online. We usually conduct this session in present. So we do ask you, what's the difference between good and poor attachment? I'm just going to go through them. Now, this baby here in this picture number 1 is similar to the baby you have seen the previous slide. But what do you see is the difference? Give yourself a few seconds. Try to see what is the difference between this picture and this picture. I will give you a few seconds to think about it, and then I will talk. I want you to appreciate the differences. What do you think of the nipple? What's happening with the nipple? What do you think of the larger ducts of the baby's mouth? Where is the tongue here in this picture compared to this one? Okay, so we can see that only the nipple is in the baby's mouth, not the underlying tissue. This underlying tissue is not there, which means the larger ducts are actually outside the baby's mouth. Only the nipple is there, large ducts are there, where this is the milk. Here is the milk. So if the baby keeps sucking here, how the milk will get inside? The tongue is far away. The tongue cannot reach these ducts, cannot press them to get the milk out. And the baby tongue is back inside his mouth and not pressing. So this is what we call actually poor suckling or poor attachment. The baby cannot effectively suckle. We'll keep suckling the whole day, but will not get any milk. Will be frustrated and upset, and the nipples will be rubbing against the baby's gum lines, and then the mother will have sore nipple, and the baby will not get enough milk, and he'll be frustrated. This is why it's very important for you to understand the difference so that you can explain it to the mothers. Now, this is from the previous picture is from inside. This is the same 2 babies, but it looks from from outside. Now, I'm explaining the cardinal signs, the 4 key components of good attachment. You can appreciate it here that more areola is visible above compared to below the baby's mouth. Don't say most of the areola is going inside, because areolas are variable in size. We said some areas are very small, they can go inside all the baby's mouth. Some areas are very large, up to here, and then you will not see much. What you need to compare is how much above the baby's mouth compared to below the baby's mouth. Typically, there should be more above. If the baby is effectively suckling or he's in a good attachment, there has to be more areola above the baby's mouth compared to below the baby's mouth. The mouth is wide open, as you can see here. The lower lip should be turned out because it's wide open. The chin of the baby should be touching the breast, or at least very near. So these are the 4 cardinal signs for good attachment that you have to observe in each time a mother is breastfeeding or is complaining about the breastfeeding process. This is one of the things that you need to assess. So more areola visible above compared to below. Mouth is wide open. Lower lip is turned out. Chin is touching the breast. In picture 2, where there is actually poor attachment, so you can see actually more areola is visible below compared to above. Mouth is not wide open, lips is not turned out, it's actually moving forward, and the chin is far away. As you can see here, chin is far away from the breast. When the baby is breastfeeding this way, even the nostrils are far away, and he will be even able to breathe effectively. Some mothers, you remember, if you know, they have this scissoring and they compress the breast because they are afraid that the baby's nose is touching the breast and he will not be able to breathe quickly. Sometimes what I do during the breastfeeding, I let her breastfeed and I take a picture, I take a photo while her baby is breastfeeding, and I show her that the nostrils are far away and he can breathe fine without her having to move the breast away with her scissoring technique. Okay, so these are these signs of poor attachment. Now, any one sign is not available and good was not there with attachment, it means it's poor attachment. So you don't need to have the 4 of them. If one of them is not there, it means this is poor attachment. Okay, you need to have the 4 signs to say that this is a good attachment. So I will repeat them. More areola visible above the baby's mouth than below. Baby's mouth is wide open. Lower lip is turned out. Chin is touching the breast or nearly so. Poor attachment, less areola is visible above the baby's mouth than below. You can see sometimes equal amounts of areola below and above if the areola is large enough. The mouth is not wide open. The lower lip is pointing forward or turned in. The chin is away from the breast. These are signs of poor attachment. Now, poor attachment is a big issue because it can cause painful nipples. Because as we said, the baby suckles only on the breast. So there is a lot of rubbing of the skin of the nipple between the 2 gum ridges of the baby. So the mother will have sore nipples. Actually, poor attachment is the commonest cause of painful or sore nipples. The commonest cause. So whenever the mother complains that she's having a painful breastfeeding, you should interfere and you should assess attachment, because breastfeeding is a painless process. There shouldn't be any pain. So some advice the mother say it's okay, it's normal to have some pain, especially at the beginning. No, if she's having pain, it means there is a poor attachment, and then it's your job to correct it. Okay, sometimes it goes from painful nipples to more severe damaged nipples. We will have cracks and fissures, and we'll be talking about it during the course. Now, if he has painful nipples and she has damaged nipples, it means the baby is only sucking from the nipple. The baby is not removing the milk, so the milk is the breast is congested, full of milk, and there will be engorgement. This is a new term. You know, when the breast is full of milk and it's not coming out, then it becomes engorgement. This baby definitely is unhappy. The baby is unsatisfied and is crying a lot, and the mother is disturbed because the baby is crying a lot. The baby is hungry, so tries to feed frequently because he doesn't get enough milk and for a long time. And actually, it causes more problems because it causes more soreness that can go into damaged nipples. And at the same time, as we talked about, fill will be there. The feedback inhibitor of lactation will be there because the breast is full of milk and it's not being removed. So there will be decreased milk production. This is why the mother will come to you and tell you that I don't have enough milk. And obviously the baby will fail to gain weight. So all these issues, whenever a mother complains of any of these, she comes and tells you my baby is not taking enough milk and is feeding frequently for a long time, then you should know that there's an issue with attachment. You should correct the attachment. Ask her to breastfeed in front of you, observe the attachment, and try to correct it. What's worse is because when the baby is unsatisfied, is crying a lot, or feeding frequently and for a long time, what mothers do, they supplement. They go and use formula feeding. And this is what we don't want them to do. So, now we'll be talking about reflexes, important reflexes in the baby. Now, a reflex is something that happens automatically in response to a certain stimulus. All of us have different reflexes. Some reflexes, we have them as babies. Some of them, they disappear with time. Some of them appear later in life. But in any way, they are responses to a certain stimulus. There are 3 different reflexes that we should know about. First is the rooting reflex. I think all of us are aware of it. When something touches the lips, the baby opens the mouth and puts the tongue down and forward. The lips or the cheeks, actually. Try to touch the baby's lips or mouth, and then you will see the baby's head is turning towards the stimulus. If it's to the right, then the baby will turn to the right. And actually, it's sort of an instinct to grab, is going to for the breast, wants to breastfeed. Sucking reflex is when something touches the pellet, the baby sucks. This is good for you to know, so that when the mother moves the baby, the open mouth baby, closer into the breast, when the nipple touches the soft pellet, this stimulates the baby sucking reflex. So the baby will start sucking immediately. Okay, so rooting reflex when you touch the lips or the cheeks. Sucking when you touch the pellet, then the baby immediately, instinctively starts to suck. Swallowing reflex, when the baby's mouth fills with milk, it will swallow. Okay, it will start swallowing to take the milk. So these things happen automatically without like thinking. These rooting, sucking, and swallowing reflexes usually happen in a healthy term babies. Babies who are ill, babies who are premature, it's a different story. These reflexes can be distorted, they may not be normal. So we're talking about healthy term babies, the ones that you're supposed to see. Okay? Most healthy term infants can actually attach themselves to the breast in the first hour after delivery without any issues because of these reflexes. This is why it is important to keep the mother and the baby together. This is why it's important to have skin-to-skin contact, because the baby can do it. The baby can breastfeed immediately after delivery because the baby is created this way. It's wired this way to be able to breastfeed immediately after delivery. So people say he cannot because he just was delivered, he's tired. But no, he is wired, he is created this way. He can immediately breastfeed, provided that we give them enough time to do it, because provide them with a safe environment. We keep them together. We do skin to skin and just wait for them and for this thing to happen. First feed after delivery can happen between 30 minutes to 90 minutes. The baby, there is something called breast crawl. The baby crawls from the mother's tummy to the breast, guided by the smell that I told you about from the Montegombly Glands, on its own. So the baby can crawl actually on after delivery immediately. And if you have been to delivery rooms where they practice baby-friendly initiative, you will see this happens. 9 steps. We'll go up to the breast. We'll take the breast. We'll start sucking and start swallowing on its own. When you explain this to the mother, mothers would be very, very interested and would want their babies to breastfeed, because so many mothers don't think the baby can breastfeed immediately after delivery. This is why we as health workers need not interfere if things are going well. So this is why we say this is important as well. When you bring the baby to the breast, try to bring the baby from below down, so that the nipple when it comes to the breast, it touches the hard palate, not from above. This, when you teach the mothers, tell her that she should put the touch the baby's 10 minutes. Okay, good. Okay. The baby chin should come close to the breast and the nose away from the breast, but the nipple is directed. The baby is coming from below, not from above, so the nose directly to the hard palate. Okay. So the baby can suckle effectively. I think I'm done. Yeah. Yeah. Okay, so we will receive questions today. If you have any questions on this, every day we'll have one of us who will be answering questions at the end of the day upon all the lectures. Today it will be me, Dr. Wafa. Every day we'll have someone different. So enjoy the next lecture. Thank you for listening. Okay, I will unmute me.
Thanks, Dr. Wafa. I hope all enjoy the anatomy and physiology. It is very informative lectures. And now there is questions. One asks, is this course equivalent to 40 hours? No, this course is 20 hours, accredited with 21 hours. The 40-hour course train the trainers different. It will take around 5 days. And the requirements for international board certified lactation consultant total 90 hours. This course can be within the requirements of IBCLC, the remaining around 70 hours to complete the 90 hours. I hope that I answer the questions for the equivalence hour. Some participants say that she's listening to the same speaker. No, since morning we passed through different speakers. Dr. Noura gave the first lectures and Dr. Amal Rassais the second lectures, Dr. Mariam Al-Awerdi third lectures, and Dr. Faiza Al-Jafar, and the last one, Dr. Wafa Fallata. And now we will listen to Dr. Faiza Al-Jafar. She will start now. Thank you.
Assalamu alaikum. I will talk now about the impact of birth practices on breastfeeding. There is a helpful practices and there is a practices with a negative impact on breastfeeding. So we will sort out what practice we will face in the labor room. By completing this session, the participant will be able to discuss the importance of early baby skin-to-skin contact with his mother immediately after birth and to initiate breastfeeding. And you can describe the procedure of placing the baby in skin-to-skin contact with his mother. You will explain how a baby moves toward the breast and attach by himself and how to help the baby if needed. You can describe how, we will describe how the health worker practice will affect in initiation of breastfeeding, and they have a major role in supporting the mother. I divided these practices into 3 stages, like first stage of labor. There is a practices that can help breastfeeding, second stage of labor, and immediately after labor. So let us go through the first stage of labor. The helpful practices in this stage, I should allow a freedom of movement during labor. If she's in early labor and she have a long time contracting, I will allow her to move around. This will reduce the pain for her, and she will feel free. Offering a light food and fluid, and no need to withhold the fluid and the food for her in early labor. She can have it because holding the food for her is distressing and causes dehydration and reduce energy for her and becomes distress from hunger. So offer her a fluid, allow fluid and food if the lady in early labor. Allow supportive companion, a supportive companion that know what's delivery and how to support a contracting mother. We should allow the companion with the mother. It is very helpful in reducing pain. In some studies that shows that it reduced 50% of the pain if there is a supportive companion. Some centers, they are using doula. Doula is a supportive companion, but anyone can support the lady who knows what's contraction, what to relieve the pain, can be helpful. A pain medication, we have an issue with the pain medication because it affects the mother and the baby alertness. It delay breastfeeding initiation and further continuation of breastfeeding. So if there is a pain killer we are using or anesthesia, it will affect in the future how long this lady will breastfeed for 4 months, 6 months, or for 2 years. It have an effect on the initiation also of breastfeeding. It will be delayed. The mother will be sleepy. The baby will not respond. The breast crawl, as Dr. Wafa she mentioned, it will not be perfect. It will not have the perfect time for the breast crawl. So this is the issues where we can help the mother or support the mother in the first stage of labor. So we allow freedom of movement and we offer food, we allow companion, we try as much as we can reduce pain medication. This is a position where the mother can get. This is in a mother-friendly situation. Some hospitals, they are seeking to be a mother-friendly, having a mother-friendly labor room. So this is a position that the mother can get during contraction or during birth. It will reduce the pain and it reduces the need for a painkiller and analgesia. Allowing the mother to walk around, moving around, she have the freedom. So this is walking, standing, and leaning like this lady. This all will help to stimulate effective contraction because the baby head is descended by the gravity, and this will help contraction effectively. Kneeling, this is another position lady can take during contraction or during birth. It will relieve the back pain if the baby is head is not fit in the pelvis. This will help to rotate. This help to rotate most of the baby head to the favorable position, the occipital anterior position. It will relieve the pain of hemorrhoid, but she cannot birth any or take long time in this position. It is only for a certain while if she have pain. She can use or this one, this position, it can be taken as for birth. This one also. But this one is against gravity. It will reduce the hemorrhoid, this position, and it will help the baby to rotate the head to fix his position in the pelvis. Sitting, the mother can take any sort of this sitting on a ball, in a chair, on the chair on the opposite side of the chair, on a boom, here on the ground. This like here squat, also in the ground kneeling. This one also sitting. All this position. It uses the gravity to help the baby to descend. It will reduce the duration of labor and they make the contraction more effective. It allows less, and if you are sitting, it will allow it to rest between contraction if you are in the sitting. Or maybe she can contract while she's standing and then she sit in between contraction. Let her choose a position for her. Let her choose let her move around and choose what is relieve her pain. Squatting is also favorable to reduce the pain and to fasten the labor. Uses gravity to help the baby to descend. Also, it opens the pelvis to provide more room for the pelvis, for the baby to descend. Then we have, this is a picture of maybe helpful furniture for the labor room. You can have adjustable bed. You can use a ball to rock the pelvis on the ball. Because of rocking the pelvis while your hand is supported and the feet on the ground, it helps to rotate the head, to change position of the head, to rotate it, to fix itself inside the pelvis. It helps to easy descend of the head, and it reduces pain also. And this chair also, it is having an opening. If you put the sacrum, fix the sacrum in this area in the hole during contraction, it will allow free movement of the sacrum during the descent of the head, and also it will reduce the pain, the backache, because the backache is from the head pushing the sacrum. We have a birth practice in the second stage, a helpful birth practices. So we talk about the first stage, what to do during the contraction. What is she can have a freedom to walk, she can have food, companion, and let her move around and choose what to do during contraction. We have a helpful birth practices in the second stage of labor. So we allow, what can we do? We can help the mother to allow her to choose a comfortable birth posture if it is available in your facility. If there is options, let's help the mother to choose the other options or show her other options. Also allow companion. So allow companion in the first stage, allow in the second stage, and allow after labor also. I will show you some positions, helpful positions in the second stage. It fastens labor and it reduces the pain and to reduce the need for analgesia. We can have this active birthing position, supported squat. She can be on the bed with to support her to have a squat position. She can have this squat where there is a space beneath the sacrum. There will be no pain, because if she sit on the sacrum, she may have pain at a certain time. She can change to this squat. This one also supported squat. This position. All of these positions will reduce the pain during the baby head descent. A birth pool, if available, asymmetrical kneeling. Some will have reduced pain with this position. Side lying with raising the upper knee. This is sitting. She can deliver in this position. This position she can do while she's on bed. This is hand kneeling on a matrix at the ground. This is also kneeling. She can do this on the hospital bed, and she can do it on the ground. So this position will help the mother to reduce pain and give her the freedom to choose a position if there is availability in your center. This is another picture of to show you a health worker how to the mother can sit in a laying during contraction or birth. This one it is a company. This is of these chairs. It have also a ball with it. This is an example of a birthing chair. We will have here a summary of birth practices that can impact on breastfeeding. Here we have the practice and here we have the impact. If we require the mother to lie flat on bed on her back during labor and delivery, this causes discomfort for her, and supine position will exaggerate labor pain, and it can have an impact on her ability to initiate breastfeeding. So what is the right thing to do? It is let her move around, walking. She can use kneeling, reclining position. She can choose a position of her choice, give her the freedom. If there is a lack of support, if there is no companion or the health worker is not helpful, so support from a medical staff or a companion will have a main role in early initiation and continuation of breastfeeding. You cannot imagine, you know, the companion will increase the duration of breastfeeding later on. So it really helps. It is for the mother. It's also companion reduce the pain. Withholding food and fluid, as we mentioned during labor, the mother will be hungry, thirsty, she will be distressed, and this will have a negative impact on her ability to initiate breastfeeding. Pain medication, it have effect on the mother and on the baby. It will sedate the mother and the baby, and the pain medication will interfere with initiation of breastfeeding, and it will interfere with the baby alertness and the ability to breastfeed. If the mother having other procedures like episiotomy, and she have an intravenous line of course, or there is a continuous electronic fetal monitoring that the mother is confined to bed, other intervention used as a routine without medical reason. So, okay, try this to use this thing only for a medical reason. If you can avoid, it's better for the mother and the baby for initiation of breastfeeding. Wrapping the baby tightly after birth, it is not advisable because we are asking for skin to skin contact between the mother and the baby. The baby cannot use the reflexes and to move freely on the mother chest in the first hour. So we need skin to skin without wrapping the baby, to put him on the skin of the mother and let him move freely. Separating. So this wrapping will negatively reduce the breastfeeding initiation and continuation. Separating the mother and the baby after birth immediately. We are asking for rooming in. Why? Because we want mother to have bond with the baby, develop the bonding and to know the baby feeding cues, to respond to her baby. So mother and baby need to be together to breastfeed early as possible and often. Separating in the labor room also reduce breastfeeding initiation and reduce the rate of skin-to-skin contact. What is skin-to-skin? Skin-to-skin, we are doing this practice after labor, immediately after labor. So we finish from first stage, second stage of labor. This is the third stage. After delivery, we should put the baby on a skin-to-skin with his mother. With his on the bare chest of the mother, chest and abdomen. Okay, and you dry the baby while the baby is on the mother chest. Okay, we will describe bit by picture how skin to skin and what is the benefit of early skin to skin. It have a lot of benefits, and we will list it in the coming slides. So how skin to skin is done? Immediately we put the baby on the mother chest and abdomen, and the nurse will or the midwife will dry the baby while he's on the mother tummy, and then you cover him with a dry towel or a blanket to keep him warm with the mother, and leave him in this position and let him do the reflexes that he know from before. So the baby will do a certain reflexes and movement that all children or babies are doing after birth. It is called the breast crawl. And this skin to skin positioning should not be interrupted for at least 60 minutes. And the mother should be supported if she's sleepy or if she have a companion with her in the labor room. Somebody should help her to keep the baby in this position. If the labor room is, you think it is cold, you can cover the head of the baby because he lose most of his temperature from his head. Then you cover with a dry towel, both of them. You wait until breastfeeding started, until the baby latch by himself without pushing, without rushing. So early initiation immediately after birth, what is the benefit of that? It promote bonding and it maintain warmth, it lower the infection rate and mortality rate. So it is related to mortality. We want to reduce infection. We want to reduce mortality. Why the health facilities are there is to reduce the mortality and infection. So we, by skin to skin, we are reducing the most distressing thing for a health facility. The benefits. I will list the benefits, some for the mother and some for the baby. For allowing the baby to find the breast and self-latch. In skin to skin, the baby will explore the mother chest and he will find the breast and he will latch. So it will allow skin to skin and without interruption, leaving the baby until he self-latch, it will allow him to find the breast and self-latch. Okay, it helps the mother to bond with her baby. She will see his face and she will be relaxed. She will forget about suturing, episiotomy. She will only look at her baby and she forget everything. So it helps the mother to bond with her baby, to develop a close, loving relationship. And it is more likely to start to breastfeed for a longer time. If we allow skin to skin, it will reduce breast complication later on. It will reduce breast engorgement. It will prolong breastfeeding and it also initiate breastfeeding. It helps to stimulate maternal milk production and supply. And as Dr. Wafa mentioned before, there is a reflexes with hormones. The baby touching, when he touched the chest of the mother, the skin, he touched the nipple. These reflexes will produce the oxytocin and the prolactin hormones, and the cascade is started of for milk production. So it also calming the mother, as you know, prolactin is calming for the mother and the baby. So this position also it calm the mother and the baby, reduce pain for both of them. It reduces postpartum hemorrhage because of internal oxytocin produced from the baby suckling to the nipple and from touching the skin of the mother. Oxytocin will be produced and it reduces postpartum hemorrhage. It also helps in the separation of placenta. Skin to skin also it helps to regulate the baby breathing, the vital sign. The baby more stable and vital sign, same as incubator. So it will regulate the baby breathing, heart rate, temperature, and regulate blood sugar. Because he have less stress and not crying, it will stable, the blood sugar level will be stable. Especially who need this, a vulnerable, low birth baby, he need the skin to skin to keep his vital sign in control. Enabling the baby to colonize his body by the flora from his mother's skin, to colonize his mucous surfaces, his gut and intestine from the flora of the mother. So what he do, the baby, during the skin-to-skin contact, he's doing the breast crawl, and part of it is to to touch the mother's skin and then to suckle his finger after that. So he is swallowing the bacteria from the mother's skin, and this bacteria will colonize his mouth and his gut and his face and his mucous membrane. All will be covered by a flora of the mother. And as you know, the flora of the mother will not harm the baby because the mother have the antibody for that. So it is like commensal for her, and it will be the same for the baby. Also, other member of the family, they can have the same colonization of this flora. So a father can do a skin to skin contact if the mother is sick and she's in the ICU. Any member of the family can do this skin to skin just to control the baby temperature, breathing, and of course, no breastfeeding will be done with other than the mother. But the other thing, the benefits of skin to skin, we can get if another member of the family doing the skin to skin, especially the colonization and the control of vital sign. It's also the colonization will help the breastfeeding and skin to skin will help to protect the baby from infection, because if he get the first milk, as Dr. Amar Sayes explained to you, what is the content of colostrum? 70% is immunoglobulin. So when the baby gets the first milk in the labor room, he will have a protection from infection. He will we will protect him by the flora, by colonization. So by many means, we are protecting the baby from infection during skin to skin contact. What is the risk of not practicing skin to skin contact? It is the opposite of all the benefits that we are getting. So if skin to skin contact is not practiced, the risk of infection from the surrounding is raised. The baby will be less stable, his respiratory and cardiac signs less stable, will have more difficulty in learning to breastfeed because we interrupt the cascade. There is a cascade for breast crawl. If we separate him, the cascade is interrupted, and then he have to collect it again to start initiating breastfeeding, because at the end of this cascade, the baby will latch and he knows what to do. But if we interrupt it, it will be delayed the initiation of breastfeeding. And the baby, if there is interruption, he will have shorter duration of exclusive breastfeeding. As their study, they follow these children if they are separated from mother. They will have delayed initiation and reduced length of breastfeeding. More maternal stress and less satisfaction from her situation. And more infant stress, more crying. Okay, the baby on the chest of the mother, he's not crying, he will settle. So if he is separated, he will be stressful, he will cry a lot, his blood sugar will reduce. The mother will have less desire to hold her infant, because of skin to skin, we help to initiate this bond between the mother and the baby. She will love her baby after this skin to skin contact. There is bonding, strong bonding built. Less ability for the infant to smell the mother milk, because there is a long duration after birth. If the baby after birth immediately put in the mother tummy and he smell the nipple, it smell like the liquor, and it is he just finished from liquor still in his nose, and then he will smell the nipple. But if there is a long duration and you wash the baby, he will forget what's the smell that he like. He will not recognize maybe the smell of the milk. Greater pain. Yeah, because bonding and skin to skin reduce pain. It increases prolactin and reduce the pain. So the baby will be more crying and it is more painful for the mother. Another benefits for the skin to skin. No tips we have to consider and skin to skin. It is we have an all time ensure safety of both mother and baby, either by a companion or by health worker. You have to ensure safety. If the mother is sleepy, she's having medication, it will impair her ability to practice skin to skin, and maybe it is unsafe to leave the baby with her. Somebody have to close monitor the mother, either by a companion or by the health worker. And don't forget to monitor the mother vital sign and the baby vital sign during this skin to skin if it take long time. When a mother and baby are in skin-to-skin contact without interruption, the baby will typically work through a series of instinctual pre-feeding behavior. يعني أشياء غريزية راح يسويها كل الأطفال. This behavior it is called the 9 stages of breast crawl. There is a video of right in YouTube, breast crawl. You will see a lot of videos, and all the babies will have a 9 stages of this breast crawl. So the 9 stages are: after birth, the first one, it is the birth cry. Our baby will do the same sequence of stages. Then he will have a relaxation after crying. Then he will have awakening. He will open his eye and look around. He will have activity. That means he will be moving. He will crawl. He will have moving his hand, touching the mother's skin, and then sucking his finger to colonize his mouth and his gut. So all children or baby will do the same. They sweep the mother's skin and put in the mouth. All of them do the same. Then he will crawl. He will look for the breast. If he's away from the breast and looking from far, the dark area of the areola, he will go for it. He will crawling. This is number 5. 6 is the first rest after crawl. So he will rest a little bit, and then resting is he closing his eye, and then he will. The 7 is familiarizing. He will look for a nipple and for areola. He will look for his mother sometimes. At this stage, he will do eye contact with the mother, or maybe he's not recognizing, but he will look to the face of the mother. And then if he finds the breast, he will go for it. He will crawl for it. And then he will start suckling by himself without pushing, without rushing. So please don't rush these stages. He will start suckling, and when he's full, he will sleep. He will have a long sleep. Now you can interrupt skin to skin, and you do whatever you are doing in your hospital. This may take over a few minutes sometimes if the mother is not taking analgesia, the baby is term, or it take an hour or more. So be patient with the mother and let all these stages to pass through, and let the baby self-latch to the breast. A longer period of skin-to-skin contact is recommended for the baby. If he didn't suckle for an hour after birth. This is some picture of the breast crawl. So this is the initial resting after crawling. He will close his eye to rest, and then he will respond or familiarize. Familiarizing, he's looking to the mother or looking for the areola and nipple, and he smell the skin of the breast, and he will go for it. A breast crawl, some pictures also here. You see the baby self-latch without the mother touching him, only watching him. The first breastfeed, the baby is moving his whole body to reach the nipple and the breast. It is very, very beautiful when you see these videos. The self-latch, a baby may take 10 to 60 minutes before starting to breastfeed. So separation only after the baby take rest after breastfeeding, after sleeping. The first hour after delivery is very important. So do not leave the mother and the baby alone for this period. She needs to be watched. She can be watched by a companion. So encourage the mother to have a companion. And the mother who decide not to breastfeed, please, or sure skin to skin contact. Let the baby take the flora, let them stabilize his vital signs. And the baby in a special care unit, if the mother, if the baby was taken, is unstable and was taken to the ICU or to stabilize him, a separation is done. So please resume skin to skin contact as soon as possible. And if the labor ward is too busy and they are rushing, you can continue skin to skin contact in the postpartum ward with a close observation for the mother who is sleepy or had a medication. We have a certain situation, a special cases regarding skin to skin contact in a preterm baby. Early initiation of breastfeeding may be difficult for a preterm infant. We encourage them to spend time at the breast as early as possible. And if they are not able to suckle, only encourage skin to skin contact. If the baby has the maturity to lick, to root, to suckle, or and swallow at the breast, let them do skin to skin contact and the breastfeeding. And if the baby is preterm, you do not expect that the baby will take a full feed because he will be exhausted. He cannot fill his stomach. So after finishing breastfeeding, immediately we ask the mother to express the colostrum and give to the baby. Do not expect that he took all what he need. Another special situation after cesarean section, what can we do? This is the role of a supportive health worker to help the mother in epidural anesthesia and cesarean section. If it is available, if you can do it, okay, do it for her. And the mother is awake and she will be happy to see her baby, and let the baby do skin to skin and suckle also. The effect of cesarean section on breastfeeding, we have effects regarding the mother, and we have negative effect on the baby. For the mother, she will be frightened and she will be stressed. She will have she will be less confident, and she will not trust her body. Maybe she will not breastfeed. So she need support. She will be confined to bed because of the suturing, because of the wound. She will be confined to bed and restricted in movement because of maybe she's drowsy and have pain. She will be deprived of energy to take care of her baby. She need a companion. So we have to take care that she have no energy. If she receive anesthesia and also analgesia after delivery for pain, then she will have it will affect the response of the baby and the mother. The mother will be sleepy and she will less attack. She will have a reduced rate of breastfeeding because of pain, because of analgesia, and it will affect negatively the duration of breastfeeding. For the baby is at high risk of not to be breastfed or breastfeed for a short duration. The baby, because he will be at the nursery, they may start bottle feeding and it have more breathing problem. The baby need suction of a mucus from his mouth. That's why he will have injury or hurt. It will hurt for him to latch. It will hurt his mouth and the throat. He will be sedated from maternal medication, and all of this skin to skin, it can be delayed. But sometimes we are seeing postnatal and the cesarean. If it is epidural, if we put the baby to skin, he will behave normally. But this is you can expect this scenario. How to take care of a mother after a cesarean section? As a health worker, how can you help her? Okay, you can help the mother to find a comfortable position for breastfeeding following a cesarean section. This is the role of health worker. If the mother still has an intravenous line, you adjust the line while she's holding her baby, and help her to put the baby to the breast. And the side lying position for the mother is preferable following cesarean section to avoid the pain if she's sitting up. So, or lying flat at her back and put the baby on the top of the mother. This also helpful to avoid touching the wound area. Provide support with a pillow. You can put a pillow to the mother if she wants to sit or to have recline position. You can put a pillow over the incision or under her knees so that she can bend her knee so that to reduce the pain and the wound does not stretch. You can adjust the bed for her if it is electronic or manual to find a less painful position. We have here a job aid for birth practices and checklist. I'm sure all hospitals, they have a checklist for this similar like this, but maybe it is different but have the same knowledge. Let's go through it. You will put the date and time of birth. She have companion or not? Did you allow it? She have vaginal, normal, vacuum, forceps delivery. Then we have the position of vaginal delivery. If she have a cesarean section, is it epidural or general? Then there should be a statement to fill skin-to-skin contact. There should be a place for skin-to-skin contact. What is the duration and when it started, when it ended, and the reason for ending and finishing without breastfeeding. If you finish prematurely, the skin-to-skin contact for an issue for the mother or for the baby, you have to mention the cause of interrupting the skin-to-skin contact. The time of the baby first fed, initiated by the baby because it have to be self-latch, or the baby was sleepy and it was helped by the health worker. The date and the time offered for the second breastfeed. And later on in the following sessions, you will know the importance also of the second breastfeed that need counseling, need support from the health worker to the mother to ensure a good positioning and good latching. If you explore your system, you will find something like this checklist. We will have a practice, a case study. You can find it in page 74. And this is the last thing we will discuss about in this session. So there is a scenario and there is, then we will see what a helpful practice, what is the non-helpful practice that have been done to this lady. So let us read the case study. Caroline had a long labor for her first baby. She's a preemie, have no experience. And no one from her family was allowed to be with her. When her baby was born, he was wrapped in a blanket and was shown to her briefly, and she saw her baby had a birthmark between his eye. Then he was taken away to the nursery because it was nighttime. The staff gave him a bottle of infant formula for the next few weeks, and Caroline baby was brought to her early in the next morning, 10 days after birth. The nurse told her to breastfeed, and Caroline started to take her baby while laying down, but the nurse told her she must always sit up for feed. Caroline sat up with difficulty, and the matrix sags and her back bend, and it was sore. There is a pain from the birth, and it was very hard to sit. The nurse left Caroline to feed her baby. She tried to help. So this is the second breastfeed that needs support. And the nurse left the baby with Caroline. She tried The Caroline tried to help her baby to put him to the breast, and she pushed the breast inside the mouth of her baby by her hand. The baby was sleepy and suckled very weakly because he had formula also. Caroline wondered if the birthmark on the baby face was caused by something she did wrong, and she felt guilt during the pregnancy, or she was worried about what her husband and his mother will say about this birthmark. The nurses look very busy around her, and Caroline did not want to ask them about this birthmark. Her family was not allowed to visit her until afternoon. The nurse returned back and saw that the baby was not suckling well, and the nurse criticized her, and she said, "How can you go home tomorrow if you cannot feed your baby properly?" The nurse then took the baby back to the nursery. Okay, we will go from the beginning. What have been done to this lady? Caroline was primary. So Caroline, this is the case study I read before. I assume that you are opening your manual. Now let us see. Caroline had a long labor, and this is the first baby for her. And no one from her family was allowed to go in. So a long labor, distressing labor, she's in pain, and she's a primary. This is a difficulty also, and no companion. Okay, so this is a negative practice. We can allow a companion here. Then her baby was born and was wrapped. So skin to skin was not allowed here, and separation immediately after labor was happened. The mother saw a birthmark, but she cannot ask them because there was not, they were busy, and nobody will allow her to ask, or they didn't ask her, "Do you need anything?" So she's wondering, why this birthmark? Am I wrong? Did I did something wrong? She had a feel of guilt. Okay, she have a long labor, feel of guilt, and she is in pain. And the baby was taken to the nursery the whole night, and unnecessarily there was no roaming in, and the baby was given a formula without a mother consent, without asking her, "Do you want to breastfeed or not?" So without asking the permission of the mother, they give the infant formula 2 feeds. So there was a separation for a long time, for 10 hours. And the nurse told her to breastfeed, but she didn't watch her. So this is the first breastfeed for her, because there was no first feed in the labor room. And this feed on the ward later on should be watched by a nurse to assess positioning and attachment. And this lady was left alone. The nurse told her, "You must sit up," while the nurse, the health worker, will be helpful if she find a comfortable position for Caroline. What is the comfortable for her? If she doesn't, if it is painful to sit, let her be on her side. Okay, let us help her to put her in a comfortable position. So at this point, the health worker can help Caroline to find a comfortable position for breastfeeding. Also to watch her, how she breastfeed her baby, because she's primary. She needs support. Primary need the most important for them to watch them, to see how they are breastfeeding, how they put the baby to the breast. Okay, she had a pain, and you know pain what do to the reflexes? It reduces oxytocin and prolactin reflexes. It will affect negatively on breastfeeding, and the baby was sleepy. Why the baby was sleepy? The baby had a formula as the stomach is full, and he cannot digest formula. That's why it stay for a long time in his tummy. And he will not suckle, because you know he will have nipple confusion from the formula, from the bottle. So he's sleepy, he's not suckling well, Caroline wonder about this birthmark, but she cannot ask them because they are in a hurry and the nurses did not give her time to ask for. She was worried about her family, what they say about this birthmark. The nurse came back to see whether she's breastfeeding well or not, and she noticed that the baby is not suckling well. Okay, instead of helping her to position her baby, she just criticized her, saying that how can you go home tomorrow if you cannot breastfeed properly, your baby properly? And then, without initiating breastfeeding, she took the baby again. You see how much of a negative practice affect a mother will affect crucial. It is a crucial effect, a crucial support the mother will have in this stage when she's in your facility for labor. If you have a support for this lady, she will breastfeed for 2 years or more. She can she can do exclusive breastfeeding if she have a good support from the health worker and understanding of the process of breastfeeding and the process of skin to skin and what is the benefit of skin to skin and the benefit of the breast crawl. It will make the breastfeeding stronger, the relation between the mother and baby stronger. The mother will have confidence. She will be confident in herself to continue breastfeeding from the first start. So now we finish our session, and you will, if you have questions, you write it down, and at the end of this day, we will answer your questions. We can start now the break, and we will start again after the break. Goodbye.
Hello, I hope everyone is back. Welcome back to this afternoon session. We have only one lecture. Dr. Amar Sayes will be talking about postnatal practices for breastfeeding. Her lecture is complementary to what Dr. Faiz Al-Jafar was talking about on the impact of birth practices. So if we apply both during delivery and after delivery practices, we will help breastfeeding. Dr. Amar Sayes is a family medicine consultant and she is a lactation consultant. So welcome Dr. Amal, and she will start now. After Dr. Amar's session, we will have the questions and answers session. Okay, welcome Dr. Amal, you can start.
And therefore increase the supplementation with artificial feed. So the objective of this session to describe the importance of avoiding prelacteal feeds and unnecessary supplementation, outline the advantage of roaming in, describe the responsive feeding and why it is important, and we will discuss the common postnatal question from the mother. What is prelacteal feed? Prelacteal feed is any artificial feed that given before breastfeeding is established or before the maternal milk come in. And this can be given by cup or spoon or the most common by bottle. On the other hand, the supplementary feeding are any food or fluid given in addition to mother's milk. And also this is unnecessary except for drops as vitamins or medicine. Why should be avoided? Why should be avoided the prelacteal feeds? So what is the danger of prelacteal feed? As we discussed before regarding the benefit of the colostrum, so if the baby is given this supplementation, the baby will be deprived from this benefit of the colostrum, and therefore there will be greater risk of infection, greater risk of allergy. And also it will interfere with suckling. How? Because the baby, when satisfy the baby hunger by this supplementation or prelacteal feed, the suckling will be less, and also the stimulation of the breast will be less. The frequency of the feeding less. So, and the baby also feed when the established will be decreased or affected. And also when the baby is taking this supplementation by the bottle, which is with the artificial teat, this may have more difficulty in latching and attachment to the breast because due to nipple confusion. So all these make more difficult to establish breastfeeding. Also, it affects on the mother. How it's affect on the mother? If a baby have prelactial feed, even in few amount, the mother have difficulty because the milk is still on the breast, accumulate in the breast, and causing a condition which called engorgement. And breastfeeding duration, it's shown that breastfeeding duration likely to be shorter if prelactial feed have been given than when the baby use exclusive breastfeeding. And we will discuss later about when the supplementation and prelactial is necessary. Mothers and health workers should both understand the risk of a prelactial feed and unnecessary supplementation. By using counseling skill, it's important to use counseling skill, listening, every time listening and learning to understand mother, why she use this supplementation. Maybe mother thinking about use this supplementation due to she have a difficulty in breastfeeding or caring her baby. Also, some mothers taking advice from other as a friend or family to give her baby supplementation. That's why important every time. First, important to understand and listening to the mother, counseling, and then provide a support to the mother and build her confidence to breastfeed. In this slide, you can see the mother and baby on the same room together. This is called rooming in. Rooming in means the baby and mother stay together for all the time, in the same room for all the time, during day and night, and should not be separated for more than 1 hour, and if separated, only for medical reason. And usually if the baby or the infant in the other bed, usually we keep the baby bed beside the mother's bed. So when the mother lying down, she can observe her baby, she can touch the baby easily, even when she is lying down. If the baby on the same bed of the mother, this is called bedding in. So important, as we mentioned before, to be together, and baby not need to put it in the nursery. Why? Because the mother is the best one and she is the very good one to observing her baby and notice any change before the health worker in the nursery. So what's the advantage of rooming in? If the baby with the mother on the same room all the time, this enhances mother to recognize her baby cues and therefore responding to his baby. And this will be difficult if the baby in the nursery or separated in other room. And helping bonding and establish breastfeeding. Ensure baby breastfeeding frequent, and this will make baby gaining weight more quickly, especially in the first week. If the baby with the mother on the same room and she's caring care of her baby, this is promote her confidence and about breastfeeding and also caring the baby even after discharge which is become insured to breastfeed her baby even after discharge. So important to be together. If baby need to be separated, for example, for medical condition or admitted in the ICU, or so we encourage the mother to visit her baby more frequent and taking care as much as possible. Early feeding cues. This sign that the early sign that the mother can be recognized on her baby, and therefore she will respond by feeding him. What is this sign? The baby opening the mouth and turning the head, trying to find the breast, being restless as baby moving some part of his body, making a small noise, making hand to mouth movement, or sucking his finger. By this early sign, the mother should respond to the baby by feeding him. If not, he will like to start crying. And we don't want mother to wait for this late cues. Why? Because when the baby is start crying, he may become stressed and therefore difficult to breastfeed him. So it's important to teach a mother or caregiver to recognize baby early feeding cues, early cues. This slide show the early cues. As you see, the baby can opening the mouth, turning head, stretching, make moving hand to the mouth, and late cues, crying and agitated. We don't want mother to wait until these late cues. Pacifier. Sometimes family use pacifier to soothe their baby, but the pacifier may interfere with mother's ability to recognize feeding cues. And feeding may be delayed until the baby is crying and agitated, which is late sign. And if hunger baby is given pacifier instead of feeding, this will interfere with baby suckling. He will suckle less, and therefore less stimulation to the milk, less frequency of breastfeeding, and therefore he will not gaining weight well. And also it will interfere with established breast milk supply. So remember to counsel the mother about the use and risk of feeding bottle and pacifier. And infant who use the pacifier usually breastfeed less in the first 24 hours. That's why it should not be used at least until the breastfeeding is well established and after 4 weeks of age. And every time advise about the use of pacifier regarding hygiene, because the pacifier can carry bacteria and also if not cleaning well, and also lead to infection as ear and dental problems. Okay, advantage of responsive feeding. The mother should be counseled to feed her baby whenever the baby wants, by, as we discussed, by learning a feeding cues. So the baby suckle as long as he wants. This is what's this advantage. This make the breast milk increase, come in sooner, and the baby gaining weight more quickly, fewer difficulty for the mothers like engorgement, and the breastfeeding is more established. Okay, what's the common postnatal question? Most of the mother ask, how long should I let my baby suckle at the breast? What you will answer? We let the baby suckle as long as he wants each time. When the baby need, just that's why we need to observe the baby. When the baby need to feed, provide for him. So the mother should not be advised to feed a baby for fixed or length time. And we advise the mother to watch the baby, not watch the clock. To watch the baby, not watching the clock. Because there is no certain time for each feeding. Usually the short feed around 10 minutes and the long feed around 40 minutes. And a mother should let the baby continue suckling until he releases the breast. They should not take them off from the breast. Because if the baby taken off the breast too soon or early before he finishing the feeding, he will not get a complete meal. As we discussed in the previous session, the complete meal should the baby take the foremilk and hind milk, to the hind milk which is rich in the fat needed by baby. If not given a complete meal, the baby will be less satisfied and get hungry again sooner. So once a baby has finished feed from one breast, mother's advised to offer the second one if he wants to continue feeding. If it is not necessary to feed from both breasts each feeding, the baby does not want to feed from the second breast, so the mother can provide the second one, the next feeding. Okay, the second question we can ask from mother, how often should I feed my baby? Allow baby, we can answer, please allow your baby to feed as early and as he wants. So, feeding baby on demand. When a baby needs to feed, provide for him this feeding. Please, we advise the mother, please don't follow a feeding schedule. Some mothers, they put a schedule as time after 1/2 hour, after 2 hours, she should feed baby. Before that time, she will not provide. No, the baby, he's the one who is the best one who he's the one who can know when he needs a feeding. And the mother recognizes that by feeding cues. And usually when once the milk supply is increased, usually around from 8 to 12 breastfeeding per 24 hours. This is the common times of feeding. The mother should know about feeding patterns, that some baby feed for short time but at frequent interval. The others can feed for long time, then they have longer gap before requesting or before needing another feed. And for all baby, the night feeds is important. Why? For milk, increased milk production due to hormone, the hormone prolactin increased at night. Some mothers came to you asking, what if my baby is too sleepy to feed? How can I feed him? How can I wake up to get feeding? The ways to wake up a sleepy baby: by remove a blanket and heavy clothes as a hat, holding baby in upright position, and gentle massage baby body. Talk to baby. If not response, we can wait half an hour, then try again. But avoid hurting baby by flicking cheek or feet. Why? Because by doing this maybe make the baby crying, and if baby cry, it will the feeding will be difficult. Thank you, and if you have any question, please comment it and we will answer all your question later on.
I hope everybody's hearing me. Thank you, Dr. Amal, for your lovely lecture. I hope everybody benefited from this lecture. So now we will answer some of the questions that we received. Somebody asked, my granny want to give my baby water, and I told her he do not need it. If he has 2 months, what can I do? You're actually very right. Babies who are breastfeeding exclusively by mothers, they don't need any water. They don't need anything else other than the breast milk. You heard now Dr. Amal, she talked about fore milk and hind milk. The fore milk contains 70-90% sometimes water. So the baby takes all what it needs from water. There has been several studies that has been done on something called osmolarity and osmolarity of the urine and the blood in different countries where there is very high temperatures and there is so much humidity, and they were testing whether these babies needed extra fluid supplements, if they needed more water, and all the studies said that babies who are exclusively breastfed, they don't need extra water. If he is formula fed, then yes, you have to give water extra. So you are right. Maybe your granny, because of her generation, so many babies were formula fed and they used to give the water. But you can really tell her that giving water at this time can replace breastfeeding and can make you not remove milk quickly from the breast and have fill that we talked about in the morning. So it means that this will decrease milk production. So you have to be careful. Any fluids that you give other than breast milk can replace breast milk, and then it will lead eventually to decrease in milk production. You don't need to give anything. Okay, there was a question. My baby always cry when I try to give her latch. I think by latch you mean breastfeeding. She is 7 months old. I started solid complementary food. This is to she reject due to this. I'm not sure what it says. She's only 6 kilos. So please advise what to do. I want to continue breastfeeding. I think I didn't understand really the question, but I think what you mean is that you are trying to give complementary feeding because the baby now is 7 months old, but the baby doesn't want the solid food and wants to continue breastfeeding only. Okay, of course, we said after 6 months, the baby needs, other than breastfeeding, needs complementary food because the energy that is needed for growth cannot be supplied only by breast milk. He needs extra. But what will happen if he insists or the baby wants only breastfeeding? What you can do, give the feeding, and then the next feed, just stop giving anything. If the baby refuses to take the complementary feeding, don't give the baby anything else. What happens is this baby is raising you. You are not raising the baby now, because now he's in control. He knows that if the baby is crying and he wouldn't take the food, that eventually you will agree and then you will give him the breast. There has been no reports of babies dying from crying or having adverse effects of crying, or there is fatal consequences of crying. Let the baby cry 1 or 2 days, and they will learn. Whenever he is hungry, he will take his food. Nothing will happen to the baby if he cries asking for the breast. And then as a reward, give the breast after the complementary feeds. It seems like sort of conditioning the baby. Now you are raising him, not him raising you. Okay, but he needs to take his complementary feeds. At 7 months, this baby at least needs 2 to 3 meals, replacing 2 to 3 feeds. So after that, you can give the breastfeeding, no problem. What else? We have a question. Sometimes while feeding baby sleeps, and when me take away the baby from breast, they cries. Again, when we offer the breast, the same continues. Some babies, what they want or what they love is comfort sucking. Actually, it's not that they are hungry. They're not hungry. They just want this the sucking from the breast of the mother. So again, if the baby cries, nothing will happen to the baby if you are not comfortable. If you are, and it's the time for you to sleep as well, it's good. Let the baby suck until the baby leaves the breast by itself. What you need to consider is the baby getting enough milk, so that you will know that actually it's only comfort sucking. To count the diapers, when the wet diapers from the urine and stool, make sure that the baby is getting enough milk. So it means that this is only for comfort sucking, and it just doesn't matter. It's not, if you stop giving the breast continuously, then the baby will just eventually go back to cry, to sleep. What's the consequences if I did not wake up the baby for feeding? You don't have to wake up the baby for feeding, but we say in general, we don't want a baby who's less than 6 months to go more than 4 hours without taking a feed. If sleeping 1 hour, 2 hours, 3 hours, just let the baby sleep. We said this is a baby-led feeding, not mother-led feeding. The baby should be the boss. The baby should decide when he wants to feed and for how long he wants to feed. So this is why we say it's on-demand feeding. In general, if more than 4 hours, you attempt to awake the baby to give him a feed, but less than that. What if the baby is a very hungry baby and little or no colostrum in the first 24 hours? I think you saw the slide where we showed the size of the baby's stomach at the first day of delivery. The first 24 hours, the baby's stomach is very small and the walls are very rigid. It will only take maybe about 5 to 7 mils. If not today, maybe tomorrow, then we'll show the slide. So actually, the baby doesn't need more than the colostrum. So probably the baby is crying for something else, not being hungry, because it doesn't need a lot in the first few days. This is why colostrum is very small in amount. So definitely there might be other causes. That check the diapers, check the temperature, check the clothes. If it's restraining the baby, maybe the baby wants the comfort being between the mother's arms. So it's not being hungry. The first feed I usually lasts the baby for the first 24 hours. How about honey? Can we give it at the age of 6 months? No, we cannot. Honey is not allowed till the age of 1 year, till after 1 year. The reason is because with honey comes a bacteria that causes a disease called botulism. And the baby's gut before the age of 1 year has small pores, and this allow this bacteria to go easily and cause this botulism, which is a very serious disease. It can cause, it's neurotoxic. It's toxic to the neurons. It's a killer actually. It's fatal usually. So after or before 1 year, we don't give babies honey. After 1 year. We say generally in the first 1 year, you don't give anything that makes the baby's food more salty or more sugary or more sweet. Just give the natural taste of all foods. Don't add anything. Okay. My baby. Okay. My baby. I feed him frozen breast milk while I'm in work is the right thing to do or not. It is actually very good that you don't want him to take formula, but we do with the frozen breast milk, just thaw the breast milk. What you do, take it from the fridge, from the freezer, and put it in the fridge until the ice melts away, and then take it from the fridge and the room temperature until it's room temperature, and then you can give it to the baby. So it's okay, it's fine. We say frozen breast milk may not have exactly the same value as the very fresh milk. The longer you keep it in the fridge, the lesser that its value, but still it's way better than formula milk. Somebody saying, do you recommend breast massage if the mom does not have enough milk for the baby? Breast massage does not increase milk production. Breast massage helps you when there is breast. We talked in the morning, remember, about the prolactin and oxytocin. If you want to increase milk production, with the baby skin to skin, more suckling, so that there will be more stimulation, there will be more prolactin, there will be more oxytocin to be released. So it's not the breast massage, just if you have like sort of an engorgement, a lot of milk is in the breast and you want it out, then you can apply breast massage. But in general, we don't recommend it. Not all women can do it in a way that they don't harm themselves. Sometimes they do it harshly and they can harm themselves or harm the nipples sometimes. So in general, we don't need to do that before breastfeeding or during the breastfeeding process to increase milk production. It has nothing to do with increasing milk production. Some mothers have no proper development of nipple. How to instruct such patient? We believe almost all breasts are capable of breastfeeding, and you will have this in the lecture that says breast conditions. Now, women who have flat nipples congenitally are very rare. Usually, what happens with the nipple, it changes its shape. It becomes a long teeth. It's the nipple is only 1/3 of the teeth. The other 2/3 are formed by the areola and the rest of the breast tissue, with the ducts in this part. So we say breastfeeding, not nipple feeding. So even if the nipple doesn't look developed well, during breastfeeding, the shape of the nipple changes. It's not the same as when you see it without the baby is sucking from it. So don't worry about that much. We say it's breastfeeding, it's not nipple feeding. Most women can develop without any issues, without any problems. We cannot see this in a woman who is pregnant. I mean, we cannot decide if she can breastfeed or not if she's during pregnancy. Usually, there is a test called protactility test. We do it the last few weeks before delivery, where you can see when you stretch the nipple, it's stretchable and its shape changes. It's the same thing when happens with the baby sucks from the nipple. So most nipples can breastfeed. هل في تشريح الثدي وعمله باللغة العربية؟ Somebody is asking هل في تشريح الثدي وعمله باللغة العربية؟ يعني موجودة المحاضرات، واحنا بنفكر نعمل محاضرات بالعربي او نفس الكورس نحاول نسويه بالعربي في المستقبل. Somebody is asking if there is the lecture about the breast anatomy, if it's available in Arabic, and I answered that we have it, and we are planning on giving the lecture and this course in Arabic in the coming few months. What are the factors that might affect a mother to do breastfeeding? For my last baby, I want to do exclusive breastfeeding, but I failed to do because I don't have enough milk. I think today we talked about so many things that you should do to ensure that you have enough milk. There is nothing called you don't have enough milk. If you are born with breast, then you are born with alveoli and secreting cells, then you are born with ducts, you are born with pituitary gland, you have natural prolactin and oxytocin. So there is no way that there is no enough milk, but there is always factors that interfere in the middle. For example, if the baby did not receive first feed, if he wasn't skin to skin, if he was not put enough on the breast, if you added supplements like bottle feeding. So every case is dealt with individually depending on the condition. So probably with your next pregnancy, either maybe by the time you finish this course, you are an expert, you will know what to do, or if not, you can see any one of us and we can go ask you what happened with that baby specifically, so that we would know what happened in the middle and it interfered with milk production. But there is nothing called no enough milk. I don't have any more questions. Okay, so if you have any more questions, or if there is anything that I didn't answer clearly, please say so. We are here. So yeah, ask please your questions. Write the questions. I think there is one new. Type, in my home country, it is the culture of old folks to let the baby suck a gauze dipped in bitter ground juice, believing that the enzyme from the juice will help the baby excrete the dirt he or she swallowed inside mother's womb. Is there any sense on this? Well, it's as you suspect, there is no sense on this. And by the way, it's not only in your country, in so many other countries, so many cultures, we have certain practices that happen immediately after delivery where they give the baby certain foods. Certainly here in Saudi Arabia, they give dates, water, they give something called Yanasoon. What's the name of Yanasoon in English? I don't remember. Anyway, so this is not practice only in your country, but we don't recommend any of these practices. They are not helpful. The enzymes will not, they will develop in their own time, and usually around the six months after delivery. Before that, no matter what you do, what you will give, the enzymes will not be mature. And this practice, as we said, just you are replacing breast milk, and this can actually lead to milk decreasing in milk production. So you don't need to do it. Somebody's asking, I tried to put my ID on the link, but there is no option to enter. I'm not sure what is this. This is technical. This is technical issue. Okay, so somebody answered you, the person who asked about the technical issue. The organizer answered you. Please send to this email. How we can contact you? I believe at the end of the lecture, the course, at the end of the course, you will be given our contact details. So you can send to us on our emails any questions or any issues that you want to discuss privately. It's okay. It's fine with us. We welcome everyone. So we have 2 questions. Oh no. Okay, a new question. Does any foods help increasing breast supply? As we hear people saying, fenugreek seeds help increase breast supply. Okay, in general, we say, as we discussed all the factors which make milk secreted and produced in the breast milk, there is no clear evidence of any foods or drinks that would increase breast milk production. Now, fenugreek, there has been studies on fenugreek. Some say that it can help, and some say that it doesn't help. So actually, women should try it and see if it would help increase her milk production or not. But in general, we suckling the baby on the breast is the best thing that can increase milk production. Yeah. Fenugreek, we can use it for those who wants also relactation, like they have stopped breastfeeding for some time, 1-2 months or so, and they want to relactate. We ask them to use fenugreek. Okay, but in general, put the baby to the breast. This is the best thing that will increase milk supply. Is there cultural challenges in promoting exclusive breastfeeding? Of course. Of course, as somebody mentioned before, that they have grandmothers who insist on certain practices, on giving certain like water with sugar or dates water or certain herbals that they say that's beneficial for the baby. It's not easy. You want to convince them, they are elderly, you want to respect them, at the same time you don't want their wrong ideas to affect the breastfeeding. So yes, of course. I think every culture should tackle its own challenges, and we have to go to these, for example, ladies, and just explain these facts to them. Try with them, involve them in our. We do this sometimes here. We involve them. We ask them to come and celebrate the say breastfeeding with us. Yeah, through support groups. We try with this, yes, but every culture should tackle its own. What do you think about using? I think she means pacifier. For soothing the baby within the hospital during short procedure, like during circumcision. Circumcision is extremely short procedure, and it doesn't take more than like minutes. So actually, you don't need to give it to the baby. The best thing to soothe the baby would be the breast milk. The breast milk has, yeah. The best thing to soothe the baby is actually the breast milk. It has a substance called, yeah, you know, I think everybody knows morphine, right? The one that is used post-op for pain. There is a substance similar as the morphine, a casamorphine, in the breast milk, and actually can help soothe the baby way better. Being near to the mother and in contact with the mother will help soothing him more than the pacifier. The issues with the pacifier will never end. They cause nipple confusion. The material it's made of, some of it can be swallowed and cause issues. It affects the growth of the jaw. It causes malocclusion of the upper of the jaw, the two jaws, the upper and the lower jaw. And so many of babies who use pacifiers will eventually need braces. The issue of dental caries and all that with pacifiers. So we don't recommend them for any length. The baby doesn't know about the pacifier, just don't give it to him. Give him the breast. Are all hospitals in Riyadh baby friendly? Sadly, no. No. Actually, how many hospitals now? We have 4 hospitals who are baby friendly in Riyadh. But which means most of the rest of the hospitals are working. We are doing these lectures or these courses so that the number increases. We want you to take the torch and go and talk to your people, your colleagues who are working with you about the importance of breastfeeding, and try to initiate such courses, 20-hour training course to train all staff concerned with mother and child to make hospitals baby friendly. متى نبدأ تثقيف الحامل وهل كل زيارة تحتاج لتثقيف الرضاعة؟ I will talk about this in Arabic and then I will shift to English. When do we start educating the mother? The second we know that she is pregnant. Does she need education at every visit? It depends on the hospital. You have to decide your own program. You can do it either every visit, or you can do it like group the visits, like every 2-3 months. You will bring her, and then you will talk about different topics, or it depends. You want to, is it the nurse or the health educator or the doctor who is giving the education? Each hospital should decide its own, but you have to do it as early as possible, because the mother is then relaxed and she will be able to receive all the information that you give her, rather than to wait until she's so stressed near delivery time or during delivery. She will not be able to accept any information from you. So you have certain topics that you have to tackle with or discuss or talk to every pregnant about, around 10 topics. So you group these topics. Either you put them like in 3 visits, or you want one topic every 1 visit. So it depends on you. نقول I will say this now in Arabic. نبدأ تثقيف الحامل من أول ما نعرف إنها حامل، من أول ما تجينا. التثقيف يختلف من مستشفى لمستشفى. كل مستشفى لها طريقة. ممكن تكون إما زيارة شخص لشخص، يعني تعليم مباشر من شخص واحد إلى الأم لوحدها فقط، ما يكون معها أحد. ممكن نتكلم عن موضوع واحد إذا نقدر، وإذا كان شخص يعني ما عنده مسؤوليات أخرى غير تثقيف الحوامل عن الرضاعة الطبيعية، ممكن نتكلم لها عن أكثر من موضوع. او تعملي لها زيارات جماعيه مثلا، تجمع مجموعه من الحوامل وتتكلم عن اكثر من موضوع في المره الواحده. المهم انه ما تخلص الحامل الفتره اللي تكون مغطيه ال10 مواضيع اللي المفروض كل حامل تكون عارفتها عن الرضاعه الطبيعيه. فتختلف زي ما اقول، كل شيخ له طريقه، في كل مستشفى لها طريقه. Vitamin K is necessary for newborn after birth or it can skip. Well, this is actually beyond the scope of this course, but it's given at the hospital. But it is necessary now. I think it's a standard practice in all hospitals all over the world, and we cannot skip it. And actually, why do you want to skip it? This is the main reason, because they notice that babies do need it. Okay, because when they are born, they don't have enough bacteria in their gut to synthesize vitamin K. This is why they give the injection. So, and it has actually absolutely nothing to do with breastfeeding. And actually, it can be given even while the mother is having the baby on skin-to-skin contact immediately after delivery. So it doesn't have to be, the baby has to be in a different location to get the injection. And while he's on the mother, this will soothe him actually after the injection. Can a lady breastfeed after breast reduction surgery? Okay, this is a big issue. Breast reduction surgeries, the problem is the surgeons, they don't really explain to ladies before that when they do the surgery, actually they are disturbing the ducts and the ductules, and the arrangement is different. So actually we expect problems with breastfeeding in women who have or who had breast reduction surgery, because it's not actually a cosmetic surgery. It's more of a it's an elective surgery, yes, but it's not cosmetic. So they do disturb the ductules. So we expect more than not that there will be issues with breastfeeding. In rare cases, there are successful cases, but usually not. And there will be a session about breast conditions, and then this question will be answered further. طيب, somebody's asking, I'm breastfeeding and walking, so I'm expressing my breast milk while at work. The problem is my baby refused to take the bottle while I'm away. What can I do to help my baby to take the bottle while I'm away? I still want to continue breastfeeding. It's so good that you are expressing. It's so good that you still want to continue breastfeeding and you want to give the baby your breastfeeding. But actually, we don't recommend giving the breast milk with a bottle. There are alternative methods of feeding. I will be talking about them actually tomorrow. But just to answer you shortly, the breast milk can be given by a spoon or by a dropper or by a syringe. It doesn't have to, or by a cup. If you heard of cup feeding, there are videos on YouTube that you can watch to see how feeding is done by each of these methods. Actually, we don't recommend the bottle because of the nipple confusion issue. So try one of these until you find something that works for you. Can you give us PDF from your slide? The course is given. There is a participant's manual. Was it sent? It was sent? Yeah, we sent the participant manual to all participants, and it has all these information, that the ones that we talked about. Someone is asking, my baby like to feed from left breast. She doesn't favor to feed right side breast when I try to give her, so she cry. What to do? There is actually a way to help you. Usually what we think the reason is what happens when the baby favors one breast over the other is the way you are holding the baby might help you. So I don't know how to explain this without showing it. The baby is on like the left breast. So if you are holding the baby with the right arm to breastfeed from the left arm. Yeah, the baby likes the left breast, and you're holding the baby with the left hand. Try to breastfeed the baby from the right breast with the left hand as well. Keep the baby held in the same position. Don't change it, just change the breast. I don't know if this makes sense. We have to show it to you. I'm not sure how we can show it. Yeah, you need to change the position. That's the only, not to change the position, the same hand. Yeah. Or sometimes try other positions. If you are using the cradle hold, there are other positions that you can use, either the saddle or the sitting, or you have to see it on YouTube. We have a lecture on. We have tomorrow a lecture on positions, different positions of the breast, and yeah, if we can have a lecture or a video about the, we'll see. We'll see if we can incorporate a video about your situation, specific situation. Okay. Thanks for all brilliant speaker. It was interesting day. Thank you very much. Okay, when to start preparing my breast during pregnancy for breastfeeding? They say I can start massaging it with cream during the last month of pregnancy. Is it right to prevent nipple crack and bleeding? No. This used to be an old practice. It's stopped now because we know there is nothing that you can do will change the nipple shape or the breast to prepare it for breastfeeding. We say that normally the nipple and the breast will change actually in the last 2 to 3 weeks before delivery. As I talked about the protectivity, it will change. So there is nothing that you can do. Plus, massaging the breast at this point can actually causes the release of oxytocin, and then oxytocin will go to the uterus, and this might start premature contractions. So actually, we advise against it. You don't need to do anything to prevent cracking and bleeding. What you need to do is make sure that you have good attachment, and this will prevent nipple cracking and bleeding.
Assalamu alaikum. I want to add some point here. For applying cream on the nipple, what's the purpose that's during pregnancy? If the purpose is for prevent nipple cracking and bleeding, as the Dr. Wafa say, it's not applicable. But if she's primary and she wants to help in opening the pores that closed, she wants to help for flow only. She will put only as moisturizing cream on the top of the nipple without massage. Without massage, only few drops of moisturizing cream on the top of the nipple or at the opening. This will help postnatal milk flow.
Thank you, Dr. Nona, for your input. طيب. So someone is asking, the question is in Arabic. I'll answer again in Arabic and in English. هل ممنوع في المستشفيات الحكومي بالذات الترويج الحليب الصناعي لأن في دكاترة كثير يشجعوا إعطاء الحليب الصناعي؟ We will talk about this in the last day. Yeah, we call it the code lecture, something called the code, and it will talk about the hospitals and the regulations and the policies, whether they can or they cannot promote breastfeeding. هنتكلم في محاضرة إن شاء الله عن حاجة اسمها الكود، إنه عن إيش بالضبط وضع المستشفيات وإيش المفروض الأطباء يسووا أو ما يسووا، واللي يشجع إعطاء الحليب الصناعي إيش المفروض نسوي لهم. What about breastfeeding in a patient with COVID? We will also it's our intention to give a specific lecture, a small lecture. It's not in the original frame of the 20-hour training course. We thought that we should add it because of the situation of COVID-19. So we will be talking about COVID-19 and breastfeeding. Is nipple shield effective or can be recommended for mothers who has inverted and flat nipples? We don't recommend nipple shields at all. Actually, they by studies, they don't exactly. Yeah, they are not really helpful. Those who have actually inverted or flat, we have to check whether they do actually have inverted or flat nipples, because some of the cases we see, we hear the mother saying that, or that someone else told her, but when we see her as lactation consultants, we found that she's fine and she can breastfeed. Okay, but in general, nipple shields are not useful. Don't use them. ما هي ال10 مواضيع يتكلم الحامل عنها عن الرضاعة? There is a lecture that will be talking specifically about educating antenatal in the antenatal classes, so you will know these topics. Thank you, Dr. Wafa. I really enjoyed your session 5 and I gained a lot. Thank you very much. Some ladies came to clinic after stopping breastfeeding for different causes for a period, but after discussion, they want to recontinue breastfeeding again. How could they recontinue? This is relactation. And I have Dr. Noura. She's the expert in relactation in our facility. We have so many cases who stopped completely breastfeeding and they came back. The success rate is between 40 to 60%, but of course it needs a mother who is very motivated. There are certain things that she should do before and when she has the baby. Dr. Noura will talk about this in one of the lectures. Mashallah, you guys are way ahead of us. Should they stop bottle feeding completely and start breastfeeding again? You mean these ladies? If they were on bottle feeding, I think it will depend on the age of the baby. But I will not go into detail. Dr. Noura will tackle it. Okay, we'll talk about it. Why you don't promote the breastfeeding in the national TV, radio, and street advertising to spread all these facts among the new moms and the old generation? We are now currently working on this strongly. We have just started Breastfeeding Association, and we are working on this promotion and all these media factors. So hopefully you will hear from us. We will be there. Let's mention that the formula companies were there for centuries now, not centuries, for so many years, and they are extremely powerful. They have so much money. But we hope that with our efforts and your efforts, those who are interested in breastfeeding, we will help, inshallah. But we are working on it, big time. Nice and helpful course. Thank you, Orfa. Thank you. Any medications like antibiotics contraindicated to breastfeeding? We have this also in erectile maternal health conditions. Somebody's asking, are antibiotics contraindicated to breastfeeding in general? Any medications that you can give a mother in the let's say primary care setting or over-the-counter medications can be given without issues, including antibiotics. The only ones that you would be worried about are the ones that are given if a mother is admitted to the hospital and she is inpatient and she is given IV antibiotics. These are usually contraindicated with breastfeeding. Still, with each condition, we will have to individualize and look and search for it. But in general, the medications mothers that can take while she is at home is of no issue. Our only issue, the first week after delivery, there are gates which are open in the breast milk and they can transmit any medication the mother takes. So this is actually the critical period. But after this first week, after delivery, the gates in the breast will close. So actually you have no issues whatsoever. You can give anti-diabetes, anti-hypertension, all antibiotics, analgesics, steroids. Most of medications can be given without issues. Okay, so now I heard from Dr. Noura. Tomorrow we will give you the link for the WHO related breastfeeding related medications. Okay, so you will have it by tomorrow. If lactating mama try to take diet plan to lose weight, this can affect the milk production? No, luckily. Breast composition doesn't change except if you have severe malnutrition, things that like in extreme situation. The usual regular dieting does not affect the breast composition. The same thing, it will be the same thing, which is sort of a miracle, because whatever you will eat, whether you are eating balanced diet or you are on a diet or you are not eating well, you take so much fried chicken and stuff like the rest of us, so your breast milk composition does not change, so you have no issues there. Is there no breast milk? If there is no breast milk yet, can mother take what? Metoclopramide to increase the breast milk. In general, we don't go immediately to metoclopramide because, as we said, we have glandular system and we have hormones. We have the breast and we have the baby. So we need to tackle the problem. We have to see what happens in the middle that made the milk not produced well. Most likely, we don't go to these medications immediately. Now, metoclopramide and domperidone, we know that they are galactagogues or they increase milk production, but they are not magic. It's not that a woman who doesn't have milk at all, she takes them, then she starts having milk. And then there are warnings. Metoclopramide has so many side effects. Domperidone, there has been a warning on its use for a long time by FDA. So we do other things and we resort to them as they are last resort, and we give it for a very short period, from 1 to 2 weeks only. You don't give it for a long time. And you will how can you join the Breastfeeding Association as a member? Okay, tomorrow we'll give you the details of how you can join our Breastfeeding Association. Okay, we need the website or the account, please, of the association. Yes, as we said, tomorrow we will have it. Okay, we're waiting for questions. Okay, we'll give you 1 more minute. If there is no questions, we will conclude this day. Anyway, thank you for attending. I hope it was beneficial. Tomorrow again, we'll meet. Can fasting affect the breast milk supply? No, this has been actually studied, and this is a good question. Thank you, because we as Muslims, all of us do perform fasting, especially for a month. In our religion, if a mother thinks that she doesn't want to fast because it might affect her baby, she is allowed not to fast. She cannot fast. It's her right. But in general, there has been studies on the effect of fasting and milk production and milk composition, and there is completely no effect. She can do it as long as she feels okay to do it. Okay, I will add to the question of medications and breast feeding. Of course, chemotherapy is a major contraindication for breastfeeding, and as I said, only the big guns that are used in the hospital and in the inpatient setting. Where can I sign? Sign what? Yeah. You signed already. ما في sign out. Sign out. Okay. Yeah, the organizers will send the sign out. If you're asking about sign out, it will be sent to you. Okay, taking lots of fluids like warm soup can increase milk production? No. Taking fluids, whether you take fluids or not, it does not affect milk production. The fluids in the breast are made locally in the breast. So drinking lots of fluids does not really affect. What we say is oxytocin can cause women to feel thirsty. So we just advise them to have fluid next to them while they are breastfeeding. They can drink, but it does not increase milk production. It's been a very interesting, informative lecture today. Thank you very much. Can we donate breast milk to orphans without actually adopting them and bring them to our homes? I think it would depend on from where you are. And we are here in Saudi Arabia, and in general in Islam, we have milk brothers. If you give your milk to another baby, a sufficient amount, it will make this baby your son and or your daughter, and your kids will be his sisters or his brothers. So in Islam or in Islamic countries in general, we don't donate or give milk to children we don't know who they are. If you are in a different country, sure, you can do that. It's not an issue, and actually it's a good thing. He's an orphan and he wants the milk. But in our country, Islamic countries, no, you are not allowed to do that. How about antidepressant or anticonvulsant medications? Again, antidepressant, anticonvulsant medications can be given with breastfeeding, and without any issue. And we have so many, most of the ones that we prescribe as, let's say, family physicians, actually we can give it without any issues and no effect on the baby. Only the ones which are very, how would I say, like not the anticonvulsants, which are used as psychotropics or psycho, how do I say, I forgot the name. I cannot get the name. Some of them which are prescribed by psychiatrists, we have to look into it. We have to make sure that of the half-life of the medication, so to tell the mother whether she can take it or not. But in general, the ones that you take in primary care or by family physicians are fine to take. Antibiotics and antidepressants. I talked about antibiotics. I said most antibiotics that you can take over the counter or in primary care are fine to be taken by lactating mothers. Only the ones which are given in the inpatient setting can affect breastfeeding. Antidepressants, I said, they are fine, can be given by mothers, to mothers who are lactating. Okay. We will send the attendance link now. Again, it will be sent to you. So please sign out. Make sure you sign out. I'm still here. I'm still receiving questions. I'm just saying if you want to sign out, if you are happy and done, it's okay. You are welcome. Can we give this education given to our women in GHA Riyadh? Can we give this education given to our women in NGHA Riyadh? NGHA is National Guard Hospital. I hope it can be organized during antenatal sessions. I really enjoy the lecture. Actually, we have two lactation educators or breastfeeding educators working full-time in NGHA Riyadh, and they give education and support to the postnatal sessions. The antenatal sessions are organized in different private healthcare center locations, and each has its own structure. We are working on them, making them all baby friendly, so we hope that we will unify all the efforts at some point. جمعية الوداد عندهم تبني بالرضاعة. Okay, Dr. Noura Al-Kharji is working with them. I will give her the mic.
شكرا للسؤال عن جمعية الوداد. عندهم تبني بالرضاعة. نعم، عندهم يتبنون الأطفال، ومن الشروط أن الطفل الأم نعمل لها induced lactation، وتعطي الطفل 5 رضعات، بعدها تقدر تاخذ الطفل. إذا في هذه الحالة ما عملت induced lactation، تحاول إنها تجيب أحد قريب من أقاربها تعطي 5 رضعات، وبعدها تاخذ الطفل. فعندهم الآن في جمعية الوداد in the Wadad Association there is a protocol. If she want to take the baby, they need do induced lactation. We work with them, and the induced lactation we are following Jack Newman Canadian protocol for induced lactation, and we succeed in maybe more than around 20 mothers now. Thank you.
The link has been sent to you if you want to sign out, huh? Do we have any more questions? The session going awesome. Wait. Why do we not have breastfeeding rooms in the malls in Saudi Arabia? This is a very good question. It's yeah, we will work on it. We will try our best. I know, I understand you. It's but by the way, this is not only in Saudi Arabia. You're talking about a global issue. It's everywhere. Um, it's not available in so many areas in the world. But we will try our best. We'll see what we can do now when we just started the Breastfeeding Association. We hope through it we will be able to be a force to start doing these things. Can you send the recording of the session due to network issues for some part of the session not attended by me? I don't think so because it wasn't. Yeah, it wasn't recorded. Yeah, you don't. Okay, we will check. We'll see if they are recorded or not. We don't know because we were not meant to record it. So we will check. You are amazing. Thank you very much. Will the recording be sent in the email? We don't know. I don't know. We didn't plan on recording these sessions. Actually, it was lectures and that you already have the participants manual. So yeah, we'll ask him. Please send me how I can do the breastfeeding team as well as the breastfeeding consultant. Consultant as an IBCLC will be, you will hear from Dr. Noura. She is the responsible for the IBCLC exam in Saudi Arabia, which is how you become a lactation consultant. So she will talk to you briefly about it. ما شاء الله the circle on فين احنا هنا I am nurse in ICU here in MGHA. Thank you very much for the good lecture. We thank you for attending this this course. Informative lecture. Thank you very much for the information. Very knowledgeable. I gain more knowledge. نحتاج يكون عندنا مكان نجمع. نحتاج يكون عندنا مكان نجمع الحليب ويكون في support من الإدارة. Of course, but it should also start from you. If it's your right, and if you don't seek your right, nobody will give it to you. This is in everything, applies to everything in life, and this is part of it. If there's a group of you who are breastfeeding, who are lactating, and need a place where you can express your milk and you can keep your milk, you have to ask for it. It's your right. ساعة لا تكفي. Well, we'll talk about this. We will see. But by the way, yeah, there is a session that we'll talk about the lactating hour given to working mothers. This is also, again, a global issue. It's not only in Saudi Arabia. I cannot open the attendance link. Mira. It was sent to the email. No, but they are all saying they cannot open it. So many are saying that they cannot open the attendance link. You put your ID and then you try. حيشوفوا هذه. Are the sessions recorded? Do we know? We have to ask him, who's responsible. The link, but all this I put new ID, but it is. كلهم يقولوا كم راسي الحين. All of them saying that they cannot. You send it again now, so please try. Please try. Do you see it? Can you see the link? ايش الاي دي اللي تقولوا عليها دي؟ كل لم أستطع لم أستطع لم أستطع I couldn't my D it only say welcome and TJ for attending. طب ايوه هو ده. متى راح تتكلم عن كيف نصبح مرشدات رضاعة طبيعية؟ The last day. مرشدات رضاعة طبيعية حيكون في برضه حتكلم عنها الدكتورة مرة واحدة مع الاختبار. هتكلم عن الاختبار عشان كيف تصير استشارة رضاعة طبيعية وعن المرشدات. Somebody is asking about how to become a breastfeeding advocate or a lactation counselor. There will be an extra session, as we said, the last day about the COVID-19 and an IBCLC exam and being a lactation management counselor, how to do it, what to be, or how to apply for it. I'm just curious how many are attending this course. Those who registered were 360 something, 360 attended. How much? 360. 360. Yes, you can. If it opened up, yes, you can leave the meeting now. أخصائية تثقيف صحي وأرغب بشدة أكون مرشدة مرخصة. قلنا حنتكلم عن الدكتورة نورة يوم الأربعاء يوم الخميس آخر يوم. Yeah, I wonder what steps could be taken to help facilitate breastfeeding at present with our COVID-19 protocol at my hospital, since baby and mom cannot have skin-to-skin or initiate feeding until mother's COVID results are available. As I said, we will have an extra session on breastfeeding and COVID-19 on Thursday. I enjoyed this session. Thank you. Actually, thank you. Anybody who is having an issue with the signing out, the organizer sent an email to contact him. لا الهوية يقصد بها رقم الهوية حقتك الرقم السجل المدني رقم السجل المدني اللي سجلتي فيه هو هذا الهوية. Now from the organizer he's saying no, it's not the national ID, it's what? The number you received in the email. You know, the number you received in the email. Number of the registration number you received in the email. So sorry, but this is what I heard because I only give the lecture. I have nothing to do with the logistics of the course. I feel that the mother and baby are released after 24 hours from delivery. Is not the short time to develop and support breastfeeding? Are you not considering extending hospitalization after childbirth? In my country, mother and baby are in maternity ward for 4 days. It is long time enough to develop breastfeeding and newborn handling skills? Thank you. Well, it's different from one country to another. Sometimes you have high birthing rates and it's difficult to keep the mother in a hospital 4 days sharing a bed when you have so many coming to the hospital to deliver. They will need the bed. That's one thing. Another thing is you are talking about infections. Hospital infections are a very high risk. So you don't want to keep the mother and the baby if they don't need to be there for medical reasons. Thirdly, this is why we talk about support outside hospital, that this is why it's important to have support outside hospitals, whether it's in the form of having a lactation consultant, or where they go to follow with their primary care centers, or they have a community nurse that goes to the mother's house. So many countries have it. Or whether you have mothers who have received a little bit of training and they can go and support such mothers, and if they needed help, they have contact with hospital personnel like us, who with the difficult cases we can help them. But the solution is not to keep mothers and babies. I'm not sure from where you are, but in our country the rates of birth are so high. Sometimes you're talking about 10,000 per month in one hospital, so it will be very hard. No, this is just what she's asking. She's about something else. She's asking whether we can, why don't we keep mother and baby after delivery in the hospital for a long time, longer than 24 hours. So I'm talking about infection is very high rate, and you need the beds. So she needs to go back to her own. I mean, even 4 days. So many mothers still have issues after 2 weeks, 3 weeks, because we say breastfeeding is an art. It needs adjustment between the mother and the baby. You will not solve it even in 3-4 days. So this is not exactly the solution. The solution is find somebody who can help her even when she is at home, when she goes back to her normal life, between her kids, with her husband, if she has a grandmother or mother who's around with her. So the answer is to have support outside the hospital. Another 5 minutes, 3 minutes. 3 o'clock. So it's another 4 minutes. So we have another 4 minutes, and then we will stop. أنا سجلت الصباح بس ما ظهر اسمي كمسجلة وليس كضيف. ما قدرت بس قدرت الآن أسجل حضور عادي. خلاص عادي الحمد لله. I entered with ID send. I was able to sign in the attendance. Yes, great actually. Mother that unable to breastfeed for medical reason, can the breastfeeding educator educate them on how to clean and prepare the formula? We say yes. We say mothers, if they insist on formula feeding, after we give them all the information necessary about breastfeeding benefits for mother and child, if she decides to still formula feed, this is her right, because this is her baby and it's her body, so we cannot really prevent her. But actually what we need to do is support her. So actually this is why it's baby friendly, not breastfeeding friendly. So we do support even mothers who are formula feeding, and actually we realize that they need more support compared to breastfeeding mothers, because it means that, because if she is formula feeding, this baby will have more issues, more illnesses, and the mother can have lots of issues like engorgement and mastitis and so on, because she's not breastfeeding. So actually she needs more support. The only thing is we need to teach her about how to prepare the formula and how to sterilize the formula, but we have to do it in a very close setting, in a one-to-one basis. We don't want any other mothers around her or any other healthcare workers, because we don't want people who are passing by to think that we are actually promoting formula feeding. So you can do it, but you have to do it in a closed one-to-one sort of situation. And actually you have to do it, as you said, if she's insisting on formula feeding, if that's her decision, after you gave her all the necessary information.